catalysis to wearable supercapacitors, solar cells, fuel cell, and also thermoelectric applications. It was a nice session. So thanks to all the speakers. And I will now hand over to the organizers for going to the next session.
Thank you, ma'am. Ma'am, could you please say the next section too? Could you please share the next section?
You are not audible.
Hello. Hello. Dr. Sharmista. Hello.
Yes.
Hello. Dr. Sharmista.
Yes.
Could you please share the next section too?
Okay. So the next session is on biomedical applications, and we have 5 speakers. So the first speaker is Dr. Grishma from Department of Chemistry, Ramakrishna College of Arts and Science, Coimbatore. Dr. Grishma, are you available?
Hello, ma'am. Could you please call Professor Rehan Khan first?
Okay. The next speaker?
No, IL98.
You are not clearly audible, organizers. Could you please repeat?
Ma'am, please call IL98.
IL90. If you can leave a message in the chat box, I'm not able to hear you.
Ma'am, she's asking about me, Dr. Rehan Khan.
Okay. Yes, Dr. Rehan, you are the last speaker. So, yes, please go ahead. Let us invite Dr. Rehan Khan from Institute of Nanoscience and Technology, Punjab. So, Dr. Khan, please.
Yeah. So my slides are visible to all?
Yes, visible.
Okay. So my name is Rehan Khan, and I'm working as an assistant professor at Institute of Nanoscience and Technology. The title of my today's talk is Dual Drug Encapsulated Modified Polymeric Coated Gelatin Nanoparticles Attenuate Experimental Rheumatoid Arthritis. So basically, in our lab, we are working on to develop customized nanomaterials for the management of different inflammatory diseases such as rheumatoid arthritis, ulcerative colitis, and cancer. So my today's talk will be focused on the rheumatoid arthritis only. So before going into the detail of my work, so I would like to give some brief idea of like about the disease. So what is rheumatoid arthritis? Rheumatoid arthritis is a chronic autoimmune disease characterized by severe inflammatory pain in joints. It is the like, most prevalent disease among all the types of autoimmune disease, and there is no perfect cure or for the disease is available. Only clinicians or like doctors, they are giving or prescribe the patients for like the management of pain only. And the hallmark of the disease is the degradation of bone due to destruction of articular cartilage, inflammation in joint, and inflammation in thickening of joint capsule. And this slide shows the different stages of rheumatoid arthritis. As you can see here, uh, this is the healthy joints, which like shows the intact cartilage and the normal histoarchitecture of the bone and cartilage, and which shows the normal synovial membrane. And the first stage of the rheumatoid arthritis, which leads to the development of the rheumatoid arthritis disease, is the synovitis. So synovitis is a condition in which there is the inflammation of the synovial membrane, which leads to the thickening of the synovial membrane, and so some sort of some level of bones or also cartilage are also eroded in this stage. And the other one is second stage is the Panas stage. The Panas stage in this, as you can see here, the red area which is like showing here, it is called the Panas. Panas is a kind of type of outgrowth in joint that can cause pain, swelling, and damage to the bones, cartilage, and other tissues. Panas formation is due to synovial tissue hyperproliferation. When there's extensive hyperproliferation in the synovial side, that will slowly lead to this outgrowth. That outgrowth is mainly responsible for the pain in patients. Because some patients report that there is a pain that leads because of this outgrowth. This outgrowth suppress the nerves, nearby adjacent nerves, that cause the pain. And the third stage is fibrous ankylosis. Fibrous ankylosis is a condition in rheumatoid arthritis disease in which joint invaded the fibrous connective tissue. And the last stage is bony ankylosis. Bony ankylosis, as you can see here, the bony ankylosis is a fusion of
Sir,
bone
your
in joint.
slide is not changing.
No, I'm not changing right now. Right now, I'm on the stages of rheumatoid arthritis. Can you see that slide?
No, we can see your title slides.
Okay.
Your slides have not moved.
Okay. Okay. Now it's visible?
Yeah, visible.
Yeah. So I was on this slide actually. So I'm going to tell again the different stages of rheumatoid arthritis. The first is this figure shows the healthy joints, and the second one is the synovitis. The second condition is the synovitis, which leads to the development of rheumatoid arthritis. And this condition is called synovitis due to the inflammation in the synovial membrane, which leads to the swelling in the synovial membrane. And the second stage is Panas formation. Panas is a type of extra growth in joint that can cause pain, swelling, and damage to the bones, cartilage, and other tissues. Panas formation is due to the synovial tissue hyperproliferation. As you can see here, the red area in this second figure is called the Panas formation. That is type of outgrowth, and it is responsible for the pain in the patient, and because it suppresses the adjacent nerves, that is lead to the pain. And the third one is fibrous ankylosis. Fibrous ankylosis is a condition in rheumatoid arthritis disease in which joint invaded the fibrous connective tissue. As you can see here, the bone, the joint is invading this cartilage in this fibrous ankylosis stage. The last stage is bony ankylosis. The bony ankylosis is a fusion of bones in joints which restricts the movement of joint. As you can see here, the bones, upper bone and lower bone, they both fuse together, and they're completely destruction of the articular cartilage. and the disappearance of the bone joint, like cartilage. That will lead to the disability in the patient. The patient will not be able to move the joints or like bend the joints. So these are the different stages of the articular cartilages. And the next stage is next to better understand the stages of rheumatoid arthritis in a more generalized way. As you can see here, the stage 1 is the body mistakenly attacks its own joint tissue, and the stage 2, the body makes the antibodies and the joint starts swelling up. In stage 3,
Dr.
the
Khan, your slides are not moving. Can you please scroll, or it's not in slideshow mode? And
uh,
yeah, now we
yeah,
have the next slide.
okay. Now can you see?
Yes, we can. Maybe you just scroll down because
Yes.
otherwise the slides are not moving.
Okay, hmm, so I'm presenting in slide mode only. So can now slides are moving?
We can see the stages of rheumatoid arthritis.
Okay.
That one.
So I'm on, presenting only in.
Yeah, use the scroll bar maybe because the slideshow is not working. So you can use the
Yes.
scroll bar.
So now moving. My slides are moving
Yeah,
now.
now it's moving. So you
So
just use the scroll bar.
okay. So, to better understand the stages of rheumatoid arthritis, the stage like stage 1. In stage 1, the body mistakenly attacks its own joint tissue. In stage 2, the body makes antibodies and the joint starts swelling up. And then in stage 3, the joint start becoming bent and deformed, and the fingers become crooked. These misshapen joint can press the nerve and can cause the nerve pain as well. In stage 4, if stage 4 is the last stage, that is called the bony ankylosing. If it's not treated, the disease will progress to the last stage, in which there is no joint remaining at all, and the joint will essentially fuse together. That will lead to the disability. And this is the probable mechanism of different probable mechanism involved in the rheumatoid arthritis disease. As you can see here, like the autoimmune trigger, and this autoimmune trigger will lead to the activation of T cells, and this T cells will lead to the activation of two types of cells, that is called Th17 cell and Th helper cells. And Th17 cell will lead to the secretion for the secretion of IL-17 cytokines, and these are and Th helper cells like uh, stimulate the macrophages, and these both macrophages and secrete the inflammatory cytokines, that is TNF alpha and IL-1 beta. These two cytokines are the majorly responsible for the development of this disease, and these cytokines, TNF alpha and IL-1 beta, will activate the fibroblasts present in the joint, that is called the FLS, and these fibroblasts will secrete the MMP2 enzyme, the metric metalloproteinase 2. MMP2 has the osteoclastic activity, and these MMP2 and some other types of MMPs, they start degrading the cartilage and start responsible for the bone erosion also. And the other mechanism is T helper cells can activate the B cells, and B cells in turn which activate the plasma cells, and these plasma cells are responsible for the production of autoantibodies and secreted by the chondrocyte, and these are responsible for again for the cartilage destruction. And one more mechanism is reported that inflammatory neutrophils are secreted at the site of inflammation, degranulate and release the enzyme that is called the human neutrophil elastase, and these human neutrophil elastase have the cartilage destruction ability that is responsible for cartilage destruction also. These are a probable mechanism involved in the development of this disease. So in our study particularly, we have chosen two different drugs, that is the glyceric acid and the other one is budesonide drug. And budesonide drug is already in the clinical use for the management of rheumatoid arthritis and other types of inflammatory conditions, and it is a type of NSAID, and the other one is glyceric acid. Glyceric acid is a natural compound that is like found in the Glycyrrhiza glabra plant or licorice plant, and it is a very potent glyceric acid is a very potent COX-2 inhibitor, and thus like suppresses the inflammation. It is well reported that, and the problem with both the drugs have some limitations. Glyceric acid is a very high first pass metabolism, therefore it has very low bioavailability, and budesonide also had a hydrophobic property, that therefore the budesonide drug has very low bioavailability. So to overcome the limitations of these two drugs, and to test the combination therapy of these two drugs, so we have developed a nano carrier that is composed of core shell structure, and we have encapsulated glyceric acid in the inner core, and we have entrapped budesonide on the outer core that I'm going to discuss in the next slide. So this is the schematic representation of my developed nano carrier. First, we have conjugated this polycaprolactone polymer. We have conjugated this polycaprolactone polymer with the aminocellulose, and then separately we have prepared gelatin nanoparticle, and we have encapsulated the gelatin nanoparticle with glyceric acid drug. This will so we will get this glyceric acid loaded gelatin nanoparticle. Then we the A reaction in this A reaction, we will get the aminocellulose grafted polycaprolactone. This is a copolymer, and then we have added both PCLAC, polycaprolactone aminocellulose polymer, and we have added both PCLAC and glyceric acid loaded gelatin nanoparticle together, and simultaneously add budesonide drug, and it will lead to the formation of this core shell structure. And the inner core, as you can see here, the yellow part, the inner core is a gelatin nanoparticle, and the pink shows the glyceric acid drug. And glyceric acid drug is a hydrophilic drug, and that is why it's we have chosen gelatin nanoparticle to encapsulate this drug, and budesonide is a hydrophobic drug, and we have chosen the hydrophobic material, that is PCLAC, and that PCLAC will graft onto the gelatin nanoparticle, and budesonide will be encapsulated in the outer shell of this nanomaterial. So this will lead to the development of this dual drug loaded PCLAC gelatin nanoparticle. Then we characterized our nano carrier with the help of NMR for the characterization of PCLAC tool. Where we have to check whether PCLAC is really grafted with the aminocellulose. Then we perform the NMR, and the NMR characteristic peaks are present for both PCL and AC. This confirms that there is a reaction happened with the reaction happened of aminocellulose with the PCL, and then we further characterize our PCLAC polymer with the help of FTIR, and both the characteristic peaks are present in the FTIR. As you can see here, the amide stretching and amide bendings are present, which shows the characteristic peaks of polycaprolactone and aminocellulose. And we further characterize our this PCLAC with the help of XRD, and then we found that the hump, as you can see here, the black line shows the hump of the aminocellulose, and this hump is present in the red color PCLAC. So which and the two characteristic prominent peaks of PCL, as you can see here in the pink line, spectra. As you can see here, both the prominent peaks are present in the PCLAC also. This further confirms that PCLAC have been formed. And then we perform the gel permeation chromatography experiment to further investigate the molecular weight, because PCL is a very long chain of and the molecular weight is 135,000 molecular weight. And when there is a like grafting of amino cellulose to the PCl, that will lead to the breakage of this long polymer chain into a shorter ones, and AC grafted onto it. So this will lead to the reduced molecular weight of PCl-AC, because when you see the long chain of polycapillary, it breaks down into a shorter one and AC grafted due to the this linking, and that will lead to the reduced molecular weight. The molecular weight of PCl-AC therefore is 34,000 as compared to the higher molecular weight of PCl. That will further confirm that AC is grafting onto PCl backbone. Then we characterize our nanoparticle with the help of dynamic light scattering experiment, and we found that the size of the blank gelatin nanoparticle is around 138 nanometer, and the PDI was 0.12. And then we performed the TLS for the blank PCl AC gelatin nanoparticle, and the size was little bit increased after the grafting of PCl layer onto the gelatin nanoparticle. That is very obvious that like the size from 138 nanometer to 187 nanometer. As you can see here, the size of gelatin nanoparticle only was 138, and the size of PCl-AC gelatin nanoparticle was 187. This leads like, to the increase in size of this nanoparticle due to the grafting of PCl-AC layer. And the theta potential of the blank PCl-AC gelatin nanoparticle was 11.2 millivolt. And then we performed the dynamic light scattering experiment for the dual drug loaded PCl-AC nanoparticle, which is our final formulation. The size was 204 nanometer, and the PDI was 0.35, and the zeta potential value was 20.3 millivolt. And then we further characterize our nano formulation, like size and shape of the nanoparticle with the help of transmission electron microscopy, scanning electron microscopy, and atomic force microscopy. So as you can see here in the transmission electron microscopy, it is clearly visible that our nanoparticle is of core shell structure. As you can see here, that the darker core inside, that is the size of the darker core inside is 135 nanometer, and the outer shell is 31 nanometer. As you can see here, this is like clearly can be seen with the help of TEM image. And further, we found that with the help of this cumulative drug release pattern of the glyceric acid drug and the budesonide drug, and we found that both the type of drug, glyceric acid as well as budesonide, shows a sustained release pattern in the PBS pH 7.4. And then we've characterized then we assess the cytocompatibility of our blank nanoparticle without any drug. We wanted to assess the cytocompatibility of our nanoparticle without using any drug to see the safety of our nanoparticle on the cell. Then we use the different concentration of the blank nanoparticle and treated the H-TERT normal cells, which is the H-TERT cell, skin fibroblast cell, and we performed the XTT assay, and we found that at two different time points, 24 hours and 48 hours, the cells up to the concentration of the nanoparticle up to the concentration of 200 microgram per ml did not exhibit any signs of toxicity on the cells, which shows that up to the 200 to 400 microgram, the cell did not elicit any type of the nanoparticle did not elicit any types of toxicity on the cell, which shows that our developed nano carrier is cytocompatible. Then we perform the then we assess the therapeutic efficacy of our dual drug loaded nano formulation against rheumatoid arthritis. First, we developed the animal model of rheumatoid arthritis. In Vistarvat, we prepared the emulsion of front complete adjuvant. We injected this emulsion at the tail base of the rat, and and we wait up to the days of 14, and after 14 days, on the day of 15, we injected the booster dose of this emulsion to induce the arthritis, and then we started the our treatment of our nano formulation at the day of at the day 21, and uh, we give the intravenous we give the our nano formulation through the intravenous route, and we give the our nano formulation doses on every alternate day. And as you can see here, the group 1 is the control group, and group 2 is the arthritis group, and group 3 is the dual drug nano formulation group, and group 4 is the free forms of drug. Both the drug in this group were used, budesonide as well as glycyrrhizide, but without nano carrier. And group 5 is the healthy rat, with just give the blank nano carrier to see the any protective therapeutic effects or any toxic effects of the nano carrier on the healthy animals. And as you can see here, like the after the treatment with our dual drug nano carrier, the severity of the inflammation, swelling, and redness both drastically reduced in the after the treatment with the dual drug nano carrier. And as you can see here, the X-ray images also show the efficacy of our dual drug nano carrier as compared to the arthritis group.
Dr. Khan,
Yes.
sorry to interrupt, but you have 2 minutes to wind up.
Okay, fine. So then we perform the Alshan blue neutral staining, and Alshan blue neutral staining, as you can see here, there's a blue color is for the proteoglycan. Proteoglycans indicate the cartilage in the joints, and like cartilage destruction is the hallmark of rheumatoid arthritis or any osteoarthritis. As you can see here in group B, which is the arthritis group, the cartilage destruction, the blue color is reduced drastically as compared to control group, which indicate that in arthritis cartilage destruction is drastically reduced. But after the treatment with our nano formulation and plain drugs also, this cartilage cartilage level is restored. As you can see here, the presence of the blue color. And then we perform the H&E staining, and we have taken the images of the three different parts of the joint, joints. That is synovium, cartilage, and bone. And synovium, as you can see here, the infiltration of the inflammatory cells are present in this arthritis group. But after the treatment with the nano formulation, this infiltration of inflammatory cells drastically reduced. That is why our nano formulation shows the anti-inflammatory effect. As you can see here, cartilage, as you can see, distorted histoarchitecture of the cartilage in arthritis group. But after the treatment with the nano formulation, the cartilage histoarchitecture restored to the normal level. And in bone also, as you can see here, the histoarchitecture of the bone is greatly disturbed as compared to the control group. But after the treatment with the nano formulation, the bone histoarchitecture restored to some extent. And this slide, this staining is for the toluidine blue staining. The toluidine blue staining for the mast cells, and mast cells are the hallmarks of the inflammation. As you can see here in the arthritis group, that is B, which shows the heavy infiltration of the mast cells in this group. And after the treatment with the nano formulation, the mast cell infiltration is greatly reduced, which is further shows that the our nano formulation shows the anti-arthritis effect by suppressing the inflammation only. And we have performed some immunohistochemistry biomarker for the different inflammatory biomarker. This is IL-1 beta, COX-2, and INOS, and our nano formulation shows that after the treatment with the nano formulation, this the expression of these particular biomarkers are reduced drastically as compared to the arthritis group. And we have performed some other biochemical estimate inflammatory biomarker with in this biomarker also the after the treatment with the dual drug nano carrier, our biomarker reduced as compared to the CIA group, arthritis group. And then we perform the biocompatibility study of our blank nanoparticle, because it is very crucial to assess cytocompatibility or histocompatibility of the blank nanoparticle, whether like it is inducing any toxic effects or not. It is very important to check. So then we have taken the H&E staining for the liver and kidney and compared with the control, and we found that there are like no histoarchitectural changes in the liver and kidney in our like blank nanoparticle treated group, which shows that our like nano carrier is safe in the in vivo condition also. And the conclusion, the result of this study suggests that dual drug dual shell nanoparticle exhibits superior therapeutic properties over free or name form of glyceric acid and budesonide in experimental arthritis. These results may be assigned to their ability to significantly inhibit inflammation. And this paper is published in Carbohydrate Polymers. And this I've added one more study, but I don't want to show this because I'm short of time. So I would like to acknowledge my Institute of Nanoscience and Technology, Mohali, which is situated in Mohali, my lab student, and DST for providing the fund to support the studies. And I would like to thank to the ICN 2020 organizer for inviting me to deliver a talk in this conference. Thank you.
Okay. Thank you, Dr. Khan, for a very nice presentation. Since we are running late, let us move on with our presentations. So I'll go back to the first speaker if she is there, Grishma KP. If not, let us move on to the next speaker, that is Indira Rajendran from
Yes, ma'am.
Biotechnology, Bonds Course College for Women, Punjab. Dr. Indira, if you are there, please.
Yes, ma'am.
Yes, please go ahead with your presentation.
Okay, thank you, ma'am. Thank you. Let's start my presentation. Good evening, one and all. Is it audible for me? Yes, ma'am. Good evening to all. I am Dr. Indra, Assistant Professor, Department of Biotechnology. The small changes in this slide, actually, I worked there in Bonsakers College from Tanjavur, but last month I changed in my college, the Moss College of Arts and Science, Kumbakonam, Tanjavur district. Now I'm presenting here. My topic is the anti-cancer efficacy of epigenetic conjugated gold nanoparticles against human epidermoid carcinoma cells, that is for A431 cells. Let's start my presentation.
Just to interrupt your slides, could you change the orientation, because it is a very narrow view that we are getting. Is it possible to change the orientation?
1 second, ma'am. Little bit wait. Ma'am, is it visible, ma'am? Ma'am? Ma'am?
It's visible. It's just a narrow view, but please continue.
Okay, ma'am. So let's start my presentation. So, what's the metal nanoparticles? So we are known all that metal nanoparticles. Metal nanoparticles is just for nanoparticles, a diameter 10 power 9 meter. We are all known that metal nanoparticle having gold nanoparticle, Ag nanoparticle, there is silver nanoparticle, platinum nanoparticle, etc. So now let's go for nanomedicine. So what's the meaning of nanomedicine means? Defined by European Science Foundation, the science and technology diagnosis, treating or preventing several diseases like relief of pain, preventing the improving health, human health, and molecular tools and molecular knowledge of human bodies. The gold, now we'll start with the gold nanoparticle, because our presentations are incorporated with gold nanoparticle. So gold nanoparticles are luxurious metals. the gold nanoparticle generally in burgundy red color. They are having some properties, the gene therapy, diagnostic sensor, stability, and widely spread applications in some biologicals. Gold nanoparticle is a extensive nanoparticles required for presence of capping agent. We are all know that. Next one, the metal nanoparticle applications. We are all know gold nanoparticle, platinum nanoparticles, and several nanoparticles. There are also several properties like DNA labeling, biosensors, drug delivery, carrier therapy, and antimicrobial and anti-cancer properties. Now, let's go for gold nanoparticle application. They are having some main properties like drug delivery, sensors, bioimaging, catalyzing, antimicrobial, and tumor imaging, then etc. Then let's go next slide. For the reduction of metal nanoparticles, metal nanoparticles have been synthesized using several chemical methods and physical methods, and then some biological methods. So the classical method is a chemical method like citrate and sodium borohydrate. It is useful for the catalysis for probes and sensors. However, the toxicity of biological system exhibited the use of chemicals, the limit in their application. So that we have to utilize alternative method for biological methods using synthesis of gold nanoparticles. Several plant extracts have been synthesized. Gold nanoparticles has been investigated already. Some enzymes and polyphenols, proteins also used for involvement of reduction in the AU ions. The biomolecules of phytochemical present in human diet can be used for reductant as a AU nanoparticles. My reductant is a epigenin. So epigenin is a polyphenol. It's a flavonoid also. It is used as a human diet. It is also found in edible fruits and vegetables, including onions, orange tree, etc. So, what is the meaning of epigenin? Means epigenin is a 4,5,7,3-hydroxyflavone. It's a flavonoid component. So, we have to choose for epigenin to reductant as a synthesis of gold nanoparticles using as a reductant. The biocompatibility and the stability of the important biological application. That's why we use it for epigenin. Epigenin, we have not only synthesis biocompatible AU and PES using reductant without any external agent, but also conjugated the polyphenols to AU NPs during the processes. We are next used for metal nanoparticle for delivery of anti-cancer agents. We are choosing for skin cancer. Cancer is a abnormal, uncontrolled cell division of cells. And the skin cancer is a common cancer in the world. Metal nanoparticles with capping agent of polyphenols serve as a delivery system for the skin cancer treatment. The possibility of conjugating when chemotherapeutic of AUNP capped with polyphenols to be excited. The action of various AUNPs on skin cancer carcinoma cells A431 to be tested. To be need to tested. Next slide. In our scope of the study, the most of the anti-cancer agents have the ability to induce apoptosis. Polyphenols with such properties can conjugate to ANPs to increase the bioavailability. Externally can be used with the linker components. Polyphenol mediated synthesis, external AUNP without any external agent challenges which can be result in the production of biocompatible AUNPs. The metal nanoparticles is a core to fungal cancer cells. Whether the metal and core polyphenol capping agent, synergistic and anti-carcinogenic agent has to be need to investigation. The main objective of the study is the synthesis of biocompatible AUNPs using epigenin and characterize them to investigate the mechanism of formation of AUNPs. The ability of the biocompatibility toward the normal blood cells and human keratinocytes, that is for Hackett cells. Whether my nanoparticles have been ability to affect the viability of A431 cell, bring out the cell death. To the study whether the nanoparticle interlies, they investigate if any apoptosis or necrosis, the type of cell death induced by external mitochondrial and caspase activity. This is the methodology of we have done with the nanoparticle. First we have to synthesis and then characterization. The characterization has been carried out two methods, chemical and physical characterization. The physical characterization carried out using TEM, XRD, DLS and zeta potential. Another one chemical characterization is FTA and TGA. Once I have to done with characterization, then I have to go for biocompatibility studies and anti-carcinogenicity studies. So we have used for blood cells and Hackard cells for biocompatibility, A431 cells for anti-cancer, anti-carcinoma, human skin cancer cells. We have to check with viability test with MTT assay, then morphological test with AT-barrier and TEM and same analysis. Then we have to move for signaling pathways like MMP, ROS and flow cytometry experiments, and then Caspase activity. This is the overall schematic representation of my work. That is for epigeny is a reductant, and then gold chloride. We form two gold nanoparticle. They are most spherical shape. They have an anti-antigenic nature, biocompatible nature, and also apoptosis of A431 cells. And then next slide, move on, key cells and inflammation. This is the overall schematic representation of synthesis of nanoparticles. So first we have to epigenin and gold chloride with the form of epigenin coated nanoparticles. First we have to check with epigenin solubility, because phytochemicals and flavonoids are a low bioavailability solubility. That we have to change their pH up to at 12. When the pH of 9 and 10 optimize the solubility, because the structure of the structure of the epigeny is C6, C9, C17 have a OH, that is a hydroxyl group, that is deprotonation of hydrogen to form a solubility. So next we have to synthesize different molar ratio and different pH with gold nanoparticles. Once again, nanoparticles. We have synthesis of a gold nanoparticle using epigenin and gold chloride. The formation of APAUNP has been used for using different molar ratio and epigenin for 1:1 to 1:2 at the different pH values of epigenin, pH 8 from 11. The mixing of epigenin and gold solution at neutral pH do not result in the formation of particles. The formation of nanoparticles occur at room temperature. The increasing and observe the color changes in burgundy red color in the pH of 9 and 10, in the molar ratio of 1.4. The peak is observed at 540 nanometer at 750 nanometer at the pH 9 nanoparticles, which is indicated the different shape of the nanoparticle, because our nanoparticle peak at 750 nanometers. So then we have to move for pH 10. So our nanoparticle gives sharp peak at obtained from pH 10 and 1:4 molar ratio. The overall synthesis can taken for 3 hours, but starting stage of 15 minutes, the nanoparticle synthesis at room temperature. The next we have to move for physical characterization of AUNPs using HRTM. The picture shows that pH at 9 nanoparticles and the pH at 10 formation of AU nanoparticles has been shown. At pH of 9, the nanoparticle shows prisms and pentagon and spherical shapes of, that is different shapes of nanoparticles, and then the size distribution also very variable. Then, but in the case of pH 10, our nanoparticle monodispersed. The SAD pattern also is clearly visible. The size of the nanoparticles are evenly distributed. So my nanoparticle size is 29.8, 29 plus or minus 10 at pH 9, around 14.5 size nanometer of pH 10. So that is indicated that our nanoparticle at pH 9 and 1:4 molar ratio have obtained correct monodispersed nanoparticles. So we have to further characterization of XRD, that is indicated that the plane triple 1, 200, 220 FS6 structure. That is indicated that our nanoparticle pH 10 is a crystalline nature of property. So next one we got to analyze for zeta potential and DLS. Our nanoparticle AU nanoparticle at pH 9 at 40 narrow peak and side peak at 22 nanometer for DLS. The zeta potential also indicated that pH 10 is a more stable because they are indicating that 32.2 MV. So next we go to analyze for chemical characterization of AU and PIS. In this, we are analyze that pure epigenin and pH 9 and pH 10 formulation of AU NPS. The broad peak of the 22 centimeter inverse at 1384 and 634 it's indicated the OH group of epigenin. The absence of 1384 indicated the presence of formation of gold nanoparticles. So pH 10 is a more stable at the this pictures indicated that our pH 10 of nanoparticles is more stable. So next sorry. So next we have to check with zeta TGA and stability studies. TGA analysis is showed the moisture of AUNPs. Almost 21% percentage weight loss has been observed. Next we have to check with different buffers and different room temperature, different temperatures for stability of nanoparticles. There is no changes in the peak. So our nanoparticles still stable for up to 1 year. After the characterization, we have to check with biocompatibility of AU NPS nanoparticles. So we have to first check with RBCs because there is a blood cells. Any nanoparticles can contact with in our body with first blood cells. We have to check with the hemocompatibility studies. Hemocompatibility studies. So the nanoparticles did not induce any hemolytic activity. So she clearly shows that that is our 200 microgram nanoparticles of didn't any changes in the nanoparticles. So our nanoparticles did not induce any hemolytic activity here. So next we have to check with biocompatible activity using MTT assay with Hackett cells. This is indicated that we have to check with 0 to up to 400 microgram per ml of gold nanoparticle with when the treatment of Hackett cells up to 72 hours. There is no changes observed in 72 hours with the concentration of 250 microgram per ml. So our nanoparticles did not induce any toxicity in normal cells up to 72 hours for the for 200 microgram per ml of samples. So we have to check with the next viability with cancer cells, that is A431 cells, that is keratinocytes, that is carcinoma cell. So we have to choose for 0 to 200 microgram per ml of gold nanoparticles. We are exposing the nanoparticles to the A431 cells up to 72 hours. We have to check with 50% toxicity observed, 150 microgram per ml of nanoparticles at 24 hours. The IC50 value obtained from 130 microgram at the after 48 hours. So once I confirm that our nanoparticles induced toxicity to cancer cells, then how to induce the toxicity cells, because our nanoparticles can enter into the cells. That is a very that is we have to check with our nanoparticle uptake has been up in the cells. This picture shows that our nanoparticles enter into the cell by endocytosis. The monodispersed nanoparticles also observed in the internal part of the cell. So our nanoparticles are more stable in the uptake of the cell. So next we have to next check with some morphological changes in the cells through fluorescence microscopy, that is confocal photography. This picture shows that confocal microscopy chromatography. The first one is control. This pictures we go to shows the ETBR and acridine orange state, that is dual staining. We are treated with for 48 hours. The green cells are considered as live cells, that is acridine orange stained cells. Then red cells and orange cells, the combination of orange with yellow cells is ATBR strained cells. This is early and late apoptotic cells. Then 100 microgram per ml of AUNP have a late apoptotic and 150 early apoptosis, and 150 microgram per ml of epigenin nanoparticles induced late apoptotic cells. That is for 48 hours. Next we go to check our morphological changes into SIM, that is scanning electron microscopy. That is a control cells. The left side of the picture shows that it is a control cell. They have more phylophilia cells. There is no changes in these cells. That is for control. When treated with a gold nanoparticle, we have to shown that 100 microgram per ml of gold nanoparticle for 24 hours. There is some changes in the after treatment has been appointed. The plasma membrane blebbing, then single and multiple blebbing, pinching of plasma membranes. They are also shown that this picture. So next we have to analyze with some morphological.
Sorry to
Yes.
interrupt. Could you please conclude in 2 minutes?
Yes, ma'am. So next we have to check with some flow cytometric analysis, annexify and cell cycle analysis. Both are this indicated that our nanoparticles induce apoptosis. Next one we are analyzing also DNA fragmentation assay. Their DNA has been fragmented. It is clearly shown that. So next we have analyzed for some signaling pathways using ROIS. So using DC FH2DA probe, the oxidative stress DNA damage has a cellular enzymes. Our nanoparticles induced ROS in 3 hours. The 200 microgram of 150 microgram AUNPs induced 55.2% of ROS has been obtained within 3 hours. Next we go check with membrane potential using JC1 dye. This is for control cells. That is for red cells. Then green one is apoptotic cells. That is for monomer cells. The histogram indicate that chart plot. Our nanoparticles induced mitochondrial membrane potential ratio has been decreased. Finally, we have checked with Caspase activity using ACDD AMC fluorogenic substrate. After 24 hours, 200 microgram AUNP, about 4.8 fold increases in Caspase activity has been observed. This is the overall representation. There is the endocytosis process can be entered into the cell. Nanoparticles entered into the cell to the induce ROS and plasma membrane. Then Caspase activation through DNA fragmentation assay. So next, the summary of the conclusion: the synthesis of nanoparticles after epigenesis as a reductant. Different molar ratio pH has been used for the synthesis of AU nanoparticles at room temperature. The maximum yield of pH 10 and 1:4 molar ratio of the epigenin gold nanoparticle has been prepared. We have to check with cytotoxicity assay using A431 cells. They are indicating that our nanoparticles induced apoptosis in A431 cells via Caspase activation. Thank you. I acknowledge to my guide, Dr. Suguna, and then CSIR giving me opportunity. CSIR giving the fellowship for Nanoshi and art project, and also thank for dignitaries and this conference members. Thank you to all.
Dr. Indra, just one quick question from Dr. Thomas. Does epigenin act as a stabilizing agent, and did you check its induced toxicity?
Yes, ma'am. It is a reducing agent. It acts as a capping agent also. We are not at all using any external agent, ma'am. The epigenin only react with capping agent, ma'am.
Okay. We also have one question from Professor Masahiro.
Yes, ma'am.
Okay, well, I'm sorry I cannot see so well because of the so picture is small, but you got too much talk. Anyway, 20 minutes presentation. You are using 38 and 39 slide, and then the quickly talking. So it's important. The presentation should be short, straight, and strong and clear. Okay, but
Okay,
it's
sir. Okay, sir.
very so many complex and so many data, so many talk, and the story is not so simple to understand. So that is my
Okay, sir.
suggestion to the you can not talk everything. You can important appealing point, okay, to make story
Okay, sir.
short and clear. And this is
Okay,
my
sir. Okay.
advice. Too many,
Sorry, sir.
too much, and very difficult to understand everything. Yeah.
Okay, thank you, Indra. We move on to our next speaker, Dr.
Thank
Rubel
you. Thank you.
Chakravarti, who is also a colleague of mine at Bhabha Atomic Research Center. So, Dr. Rubel, if you are there, could you please
Yeah,
go ahead with your presentation? I think,
good
Dr.
evening.
Indra, you need to stop sharing your slides.
Yeah,
Dr. Rubel, yes.
good evening, everybody. Thank you, Chairperson, for the kind introduction. And first of all, I would like to thank the organizers, and especially Professor Sabu Thomas, for giving me an opportunity to present my work in this forum. So I will present my slides. Can you see my slides?
Yes, we can see.
Yeah. So my talk is on synthesis of intrinsically radio-label nanoplatforms for cancer theranostics. So I have planned my talk in this way. First, I'll give a brief introduction to nanomedicine. I'll talk about the diagnostic imaging techniques using radio-label probes, and then I'll talk about targeted therapy. Briefly, I will introduce the concept of theranostics. Then I'll discuss the different radio-labeling methods of nanoparticles, and I'll specifically focus on the intrinsically radiable nanoparticles, which our group is among the pioneers in this field. Then I'll discuss some of the recent developments on intrinsically radiable nanoparticles from our group. I'll also discuss some of the challenges towards clinical translation of the radiolabel nanoparticles. So first coming to nanomedicine, as we know that cancer is a global menace, and we have seen several lectures in this conference on nanomedicine playing an increasingly important role in cancer imaging and therapy. We know that molecularly targeted nanoplatforms afford many advantages over the conventional approaches for cancer management. They not only give signal amplification, but also lead to enhanced binding affinity and specificity. The nanoplatforms demonstrate enhanced targeting efficacy. It's possible to club two different types of imaging. That is, it's possible to have multimodality imaging. We always say two is better than one. Similarly, it is possible to take advantage of two different therapeutic approaches simultaneously. Like chemotherapy and radiotherapy can be clubbed together. And finally, it is possible to monitor the therapeutic efficacy by non-invasive visualization techniques. Therefore, there is a worldwide effort towards synthesis of novel nanoplatforms which can shed new light on molecular diagnostics and therapy. So nanoplatforms which are used can be organic nanoplatforms like dendrimers, liposomes, etc. Or they may be inorganic nanoparticles like mesoporous silica, iron oxide nanoparticles, or they may be hybrid ones. So we have used both inorganic as well as organic nanoplatforms. So before that, I'll discuss about the diagnostic imaging of cancer. So briefly, as we know that a cancer can be imaged by X-ray CT, ultrasonography, MRI, or functional MRI. Generally, these techniques are anatomical techniques and they give only anatomical information. Whereas the nuclear imaging techniques like positron emission tomography or single photon emission computed tomography gives not only the physiological but also metabolic and as well as molecular information. They also tell you that cancer has occurred, in which stage the cancer is, and whether it has metastasized to other parts of the body or not. It also helps in finding what is the origin of the cancer, what type of receptors are overexpressed. So you get molecular information from nuclear imaging techniques. The optical imaging also gives molecular information, but it is still not possible to non-invasively visualize deep-seated tumors using optical imaging techniques. So the most common technique in nuclear imaging is either positron emission tomography or single photon emission computed tomography. I'll give the example of positron emission tomography. In this case, a radionuclide in a suitable form is administered. This is generally a beta plus emitting radionuclide. This accumulates in the tumor site, and then it emits positron, which is a beta plus. This positron captures an electron and annihilates to give two 511 keV gammas, which are detected by radiation detectors in coincidence mode. These detectors surround around long axis of the patient, and three-dimensional picture is obtained so that you can visualize whether the tumor has occurred and whether the cancer has metastasized to other parts of the body or not. So this is one of the most powerful techniques for cancer staging, diagnosis, as well as for therapy monitoring. Now coming to therapy of cancer using radionuclides, the targeted drugs, therapeutic drugs, has to be sent to the cancerous cell very specifically so that they can destroy the cancerous cell very selectively without affecting the normal tissues. So targeted therapy offers a new hope in cancer management. And then recently there's a concept of theranostics where we combine diagnostics along with therapeutics for personalized cancer care. I'll give an example. For example, in case of theranostic, the agent which is administered should be same agent or similar agent should be able to show, should be able to visualize the disease, as well as at different dose should be able to kill the cancer cell. So initially in a patient, the radio level agent is administered, and then it is detected using, say, positron emission tomography scan. Here you can see a PET scan where the black spot shows the metastasis in different parts of the body. Once the staging of the cancer has been done, then therapeutic dose is administered, and then again using post-therapy scan, you can see whether the cancer has decreased, whether the metastasis have decreased, or there is benefit of the treatment or not. Depending on that, the surgeon will decide whether to retreat or re-administer a dose. Thus, we can combine both diagnostics and therapeutics for tailor-made cancer care for benefit of individual patients. So coming to cancer targeting using nano platforms, this has been discussed in the lectures today also. So basically the nanoparticles, they accumulate in the tumor by enhanced permeability and retention effect. Basically, there's a rapid vascularization in the cancerous tissues, and these vascularization has certain fenestrations or windows which are nanometer sized. So these nano-sized particles, they permeate and accumulate in the cancerous size because of these fenestrations in the vascularization. Once they enter the cancer site, you know that lymphatic drainage is impaired in cancerous tissues. So once they enter there, they get accumulated in the cancerous site, and therefore they can give diagnostic or therapeutic benefit. This is passive targeting or EPRF, enhanced permeability retention effect. If you attach some targeting ligands like antibodies or peptides on the surface of the nanoplatforms, then certain cancers overexpress receptors. These receptors, these targeting ligands can bind with these receptors, and therefore they can show enhanced uptake as well as significantly longer retention in the cancer site. This is known as active targeting. Generally, we take the advantage of both passive and active targeting for using radio nanomedicine for benefit of cancer patients. So coming to radio labeling of nanoparticles, why radio labeling is important, or what is radio labeling? Radio labeling is basically incorporation of suitable radioisotopes in nanoparticles, which aids in non-invasive diagnosis, as I mentioned, using positron emission tomography or SPECT technique. It helps in understanding the biodistribution and pharmacokinetics of nanoparticles. Also, for drug delivery, it helps in understanding the biological fate of the nanoplatforms. It helps in visualizing the drug delivery. It's possible to combine two imaging modalities, that is multimodality imaging, and we can take the advantage of two different therapeutic approaches simultaneously, like chemotherapy and radiotherapy, to give an enhanced benefit. So it gives advantage of multimodality therapy. Also, it can help in monitoring the therapeutic efficacy. So there are four different radio labeling methods. The first is using conventional chelators or the surface of nanoparticles, and these chelators can complex with the radiometal ions. The second is you synthesize a nanoparticle and then you irradiate in a reactor or a cyclotron. This is not a very preferred approach because bombardment of these nanoparticles with hadronic particles may lead to deterioration in the structure. So this approach is not very widely used. The fourth is based on adsorption of nanoparticles of radionuclides on a nanoparticle surface. Again, there is some limitation because these radioisotopes may come out of the nanoparticles when administered in vivo. They may not demonstrate in vivo stability and may lead to off-targeting. Therefore, we have focused on the synthesis of nanoparticles using radioactive precursors, and which we call as intrinsically radio-labeled nanoparticles. And in fact, we are among the pioneering groups in the world on synthesis of these class of nanoparticles. In this, we used cold precursors as well as hot precursors to synthesize the radioactive nanoparticles. So the major advantage of the intrinsically radio-level nanoparticles are they demonstrate excellent radiochemical stability, not only in vitro, but also in vivo, because the radioisotopes are the part of the crystal lattice in this case. And therefore, it demonstrates minimal off-targeting, because if off-targeting happens, the radioisotope may go to some other organ and may give unnecessary dose, and it may give spurious image. Additionally, the inherent pharmacokinetics of nanoparticles are not compromised, and it is possible to use low specific activity radiometals, which are generally not suitable for preparing target-specific radiopharmaceuticals. Also, some of the radiometals like 198 gold or platinum, whose coordination chemistry is not that favorable for preparation of conventional radiopharmaceuticals, can also be utilized for preparation of intrinsically radio-level nanoparticles. Generally, the synthesis procedures adopted are facile, so that it is possible to formulate clinically relevant doses while adhering to the regulatory guidelines. Now I'll give up examples of some of the recent works from our group. The first is the synthesis of copper sulphide functionalized nanoparticles. I must mention that copper sulphide is a very interesting theranostic radiometal. It decays by beta plus as well as beta minus, so it can be used for PET imaging, non-invasive visualization, as well as for targeted therapy. So this particular radiometal was produced in our nuclear reactor, Dhruva reactor at DARC, and we have directly converted this into copper sulphide nanoparticles by selective precipitation, controlled precipitation using sodium sulphide. And then we have developed two classes of nanoparticles. One is the bare copper sulphide nanoparticle in a surfactant, the CTAC, cetyl trimethyl ammonium chloride, and the PEG functionalized copper sulphide nanoparticles. So this shows the TEM micrograph. You can see the particle size is around 30 to 40 nanometer. And we had administered these nanoparticles in tumor-bearing mice, melanoma tumor, a skin cancer-bearing mice, C57BL6 mice. So when we administered the bare nanoparticles in CTAC medium, we saw huge liver uptake. Of course, there was some tumor uptake, but liver uptake was high. So we coated these nanoparticles with polyethylene glycol, which made it more hydrophilic, and therefore the opsonization or the rapid clearance from the hepatobiliary route was reduced, and tumor uptake was enhanced. Gradually, liver uptake reduced, and we could get good contrast over a period of time. So this was the first class of copper nanoparticle studied. However, this copper sulphide nanoparticles demonstrate some sort of toxicity. Therefore, we thought of synthesizing more biocompatible nanoparticles. For that, we synthesized 64 copper metal nanoparticles encapsulated in human serum albumin scaffold. So this is an interesting synthesis in which the human serum albumin itself acts as a complexing agent as well as it acts as a reducing agent. So at pH 12, it forms the complex, and then it was heated, and we could get copper HSA nanocomposite. The XPS studies clearly show that copper exists in the form of copper metal in zero oxidation state. And again, we did preclinical studies in melanoma tumor-bearing mice. In this case, we saw that tumor uptake was enhanced compared to the copper sulphide nanoparticles. Initially, there is liver uptake. Of course, any nanoparticles show liver uptake. It clears through hepatobiliary route and gradually decreases with time. And the liver to tumor to background ratio significantly enhances with time. And therefore, this is quite suitable for treating or visualizing the cancerous cells. The next class of nanoparticles that we studied was gold nanoparticles, functionalized with RGD peptide, a cyclic RGD peptide, which targets the integrin alpha V beta 3 receptors overexpressed in the neoangiogenesis or newly growing tumor cells. So in this case, we synthesized 199 gold nanoparticle. Again, 199 gold is an interesting theranostic radioisotope. It has very good nuclear decay characteristics, but the coordination chemistry of one gold is not favorable for preparation of conventional radiopharmaceuticals. Therefore, we have used 199 gold in the form of chloroodic acid, and we have added RGD peptide. This RGD peptide itself acts as a reducing agent, and it attaches to the nanoparticle surface, and this could be used for targeting of tumor. This shows the TA micrograph, and we could synthesize nanoparticles in the range of around 10 to 12 nanometer size. It's interesting to note that when we did the CD studies, the cycler dichroism studies, the negative ellipticity of the nanoparticle in the visible range, you can see the peak in the visible range, which corresponds to surface plasmon resonance of the gold nanoparticles. This is a characteristic peak of gold nanoparticle that could be seen even in CD spectrum. This indicates that the nanoparticle is conjugated, or the cyclic RGD peptide has conjugated with the nanoparticle. It's a covalent interaction, or sort of interaction with this peptide has interacted with the nanoparticle. It not only acts as reducing agent, but also attaches to the surface of the nanoplatform. So with this, we did some cell binding studies using these nanoparticles, using melanoma cell lines, and we could see that radio-level nanoplatforms have good affinity for the cell line. And also, when these cell lines were inhibited with excess of nanoparticles, there was a reduction in uptake, which shows the specificity of these nanoplatforms towards the melanoma cell. With this information, we did the biodistribution studies in tumor-bearing mice after intratumoral injection. And you can see in this case, the nanoplatforms or radioactivity is retained in the tumor even after 192 hours of administration. So with these information, we did tumor degradation study, or actually demonstrating therapeutic efficacy. We administered different doses of nanoparticles in the tumor-bearing animals. And you can see that when the animals were untreated, the tumor size increased with time. Whereas at a particular dose, say 5 megabecquerel of nanoparticle, the tumor started shrinking, and subsequently it almost disappeared. At this dose, the weight of the mouse did not change with time, which indicate that these radio-level nanoplatforms did not exhibit excessive radiotoxicity to damage the other organs or the behavior of the mouse. We also synthesize similar nanoplatforms using 198 gold, which is another important theranostic radioisotope. The synthesis procedure is similar, but in this case, we administered through intravenous route. In the earlier case, we had administered through in the tumor, but in this case, we are administered intravenously, because intratumoral administration is possible only when the tumor is superficial. Whereas when the deep-seated tumor is there, then it has to be administered intravenously. So to demonstrate the efficacy of this class of nanoplatforms for targeting deep-seated tumors, we have done intravenous administration. Of course, the nanoparticles demonstrate excellent colloidal stability and radiochemical stability over a period of time in vitro conditions. Again, this shows the intravenous administration in tumor-bearing mice, which saw good tumor uptake of around 8 to 10% ID in the injected dose per gram over a period of 4 hours after injection, and it was significantly retained up to 168 hours of injection. In this case also, we demonstrated in vivo the specificity of these nanoplatforms for the tumor. We had chosen melanoma cells, melanoma tumors, which are known to express alpha B beta 3 expression, integrin alpha B beta 3 expression. So when we administered the nanoplatforms, see, you can see that green ones are targeted nanoplatforms. So when we administered these nanoplatforms and we administered excess amount of peptides, the uptake of the nanoplatform is blocked or it reduced. This showed that these peptide conjugate nanoplatforms are specific for these type of tumors. Also, we took scrambled peptide of different sequence, which is not RGD, but a similar peptide, which is not specific for the tumor. In that case also, we saw much lower uptake. This small uptake which we see in this case is because of the passive targeting or EPR effect. So 1 or 2% uptake, which is almost corresponding to the background. This study proves that our nanoparticles have specificity towards the integrin alpha B beta 3 expression in melanoma tumors. In this case also, we did tumor regression studies. And as in the previous case, we saw significant reduction in tumor size after administration of 37 megabecquerel of the 198 gold nanoparticles. And the tumor almost disappeared over a period of 15 days. Coming to another interesting work which we did in our group was use of some organic nanoparticles, chitosan nanoparticles, and these nanoparticles could be labeled with a variety of radionuclides like 177 lutetium, 167 holmium, copper 64, 68 gallium, 90 yttrium. These are very established theranostic radiometals in nuclear medicine, and all these nuclear medicine radiometals could be complexed with the chitosan because chitosan has a property of complexing with +3 metal ions. And then by using the conventional ionic gelation approach, this was converted into nanoparticles. These chitosan nanoparticles were intrinsically radiolabeled with different radionuclides. The nanoparticles were around 50 nanometer size, and then we administered these nanoparticles in normal rats. In this case, we only demonstrate the in vivo stability because if the nanoplatform, if this radioactivity, which is complex in a nanoplatform, leaks out, then it will show bone uptake or what is known as tibia uptake. But in this case, we saw it's liver uptake. Liver uptake is expected because nanoparticles, when administered intravenously or in vivo condition, clears to the hepatobiliary route. But there was no uptake in the bladder or in tibia, which shows that the nanoparticles retain their integrity over a prolonged period of time. So these nanoparticles or these organic nanoplatforms, when conjugated with suitable targeting agents, can also be used for cancer imaging and therapy. Another interesting work which we carried out is the synthesis of lutetium oxide nanoparticles. Lutetium is one of the most important radiometals which is used in our country for treatment of variety of cancers. So we developed a new method of using this 177 lutetium. We complex this lutetium with human serum albumin, and then it was precipitated in a controlled manner using NOH, and we could get lutetium oxide human serum albumin nanocomposite. This shows the TA micrograph, and nanoparticle size is around 5 to 8 nanometer. We did this cell binding studies with lutetium HSA nanocomposite in different type of cell lines. I'll give the example of melanoma cell line. Again, in this case, we can see significant uptake by the cells for the radiolabeled nanoparticles. And when these cells were incubated with excess nanoparticles, excess of cold nanoparticles, the uptake decreased, which shows the specificity of these nanoparticles towards the cell line. Also, we did flow cytometry studies to demonstrate the toxicity of these nanoparticles. We see that the unlabeled nanoparticles, inorganic nanoparticles are, in this case, it's almost 90% cells are viable. Whereas when you administer radio-labeled nanoparticles, the significant cell death was caused. The cell toxicity studies demonstrate the utility of these nanoparticles for therapy. With these information, we administered these nanoparticles in tumor-bearing mice intravenously so that it can be used for studying the deep-seated tumors. And again, you can see there's very good tumor uptake of more than 10% ID per gram within a very short time of 4 hours. The nanoparticles clears to the hepatobiliary route, and gradually the liver uptake decreases, and the tumor uptake is retained over a period of 168 hours. In this case also, we did tumor degradation studies in different groups of animals, administering different dose. So we found that if you administered, the green line shows the administration of 30 megabecquerel dose, the tumor decreases and eventually it disappears over a period of 3 weeks. But if you administer more dose, say 55.5 megabecquerel dose, then there is significant weight loss of the animals. That means this dose is not appropriate, and it can lead to radiotoxicity or harm to other normal organs. Therefore, the
Dr.
optimal dose.
Chakraborty, could you wind up in one
Yeah,
or
sure.
2 minutes? Yes.
Yeah. So we decided to move with the 37 megabecquerel dose. So now to prove that these 37 megabecquerel dose does not have any adverse effect, we did biochemical and hematological parameter studies were done by doing blood test. And we found these parameters were unaffected compared to the control group. We also did histopathological analysis of the liver and kidney of the treated animals, and this is the histopathological this thing, which shows that there was no evidence of degradation, and therefore we could conclude that evaluation of treated and non-treated animals showed clear differences in the tumor, necrosis in large areas, and hemorrhage with intermixed spots could be seen in treated tumors. So we can clearly see that radio level nanoparticles could successfully treat the tumors without affecting the normal organs. So this is the last slide. So we have also synthesized, recently we have synthesized in a group 169 ytterbium oxide nanoparticles coated with gum arabic. This is an interesting nanoparticle which can be used for tumor therapy as well as imaging. So these nanoplatforms were administered in tumor, and SPECT CT studies were carried out. And this shows the image after 7 days. And you can see that it is very specifically retained in the tumor, and it does not show uptake in any other part of the body, which shows that these nanoplatforms are very good for specific targeting as well as for therapy. So coming to clinical translation of nanoparticles, the first we have to address the toxicity concerns. That is why it is essential to synthesize biocompatible and biodegradable nanoplatforms. A major challenge with the nanoplatforms is they clear to the liver and is uptake in the liver. So therefore, it is essential to control the shape, and preferably if you can synthesize less than 5 nanometer size nanoparticles, then it shows clearance through the renal route like small molecules. However, till now there is no successful synthesis of small size nanoparticles which can also show effective cancer targeting. Moreover, it is essential to synthesize the nanoplatforms using complying to the regulatory guidelines, especially CGMP standards. So this is only one nanoplatform translated to the clinic. I will not discuss about it, but it is a small size nanoplatform labeled with 124 iodine, and it is approved by the FDA for investigation clinical trial. And this is the only one radio level nanoplatform which has gone to the clinic till date. So coming to the conclusion, intrinsically radio level nanoplatform is a novel strategy for effective cancer imaging and therapy, which shows improved cancer targeting compared to conventional approaches. It gives the scope of multimodality imaging as well as therapy, and therefore this is an attempt towards personalized cancer management tailored for the benefits of individual patients. Thank you very much.
Thank you, Dr. Rubel, for a very nice presentation. We have some questions from Dr. Thomas. Does radio labeling cause toxicity, and which of them is better, 64 copper or 177 lutetium?
Yes, radio labeling cause toxicity because we want to kill the cancerous cell by taking advantage of the emissions from the isotopes. So we want to cause toxicity, but it should not cause, as I have shown, that this does not cause sufficient toxicity to the normal organs. Coming to the question of lutetium and copper, it depends on the usage. Copper 64 is a beta plus as well as beta minus emission. It's an emerging radionuclide. So mainly it is used for diagnostic applications, whereas lutetium 177 is established therapeutic radionuclide. So depending on the requirements, we have to decide which radioisotope we have to choose, depending on the tumor, depending on the size of the tumor, depending on origin of the tumor, we have to choose the radionuclide.
Thank you, Dr. Rubel. Thank you.
Yeah. So if there are no more questions, we can move on to our next speaker. Thank Dr. Rubel for a nice presentation. Our next speaker is Dr. Sunita Patel from School of Life Sciences, Central University of Gujarat. Dr. Patel, please go ahead with your presentation.
Yeah, thank you, ma'am. Is my slides visible?
Yes, you are visible. Slides are visible.
Yeah. Thank you, ma'am. So very good evening to all. My heartfelt thanks to the organizer for providing me the opportunity to present my research work here. So for the next 15 to 20 minutes, we are going to talk on the topic of my presentation, that is enhancing the anti-cancer activity of plumbagin by using albumin nano carrier for potential therapeutic use in breast cancer. As we all know, cancer is one of the most detrimental diseases, claiming the lives of millions worldwide. Nowadays, cancer has become one of the most common public health issues due to increased prevalence, morbidity, and mortality caused by complications. Globocan 2020 data suggests that the global cancer burden has increased to 19.3 million new cases and 10 million cancer deaths. In female, breast cancer is the most commonly diagnosed cancer and the leading cause of cancer death. If we will look at the statistic, then we can find that the breast cancer occupy the major percentage of cancer cases and cancer deaths in women. These are the different treatment options available, or the combinations of these approaches for the treatment of breast cancer. However, the current treatment regimen are not sufficiently satisfactory because of toxicity, non-specific delivery of drug, and resistance against chemotherapy, which are the main obstacles. So always there is a pressing need of research progress to provide novel therapeutic agent of nature origin with a good efficacy and strategic delivery, leading to less toxicity and high selectivity. So the drug that we have chosen is plumbagin, which is a natural biologically active naphthoquinone, and but it shows a number of pharmacological activity, though it has number of biological activities, but its lower water solubility, slight absorption, and low bioavailability limits its biomedical application. So we look for a smart strategic delivery, and we use nano drug delivery vehicle. And the drug delivery vehicle that we have chosen is albumin protein, because it's one of the most abundant plasma protein that is present, and structurally it's a helical protein, and with a molecular weight of 65 kilodalton. It's a monomer, it's a single polypeptide chain. It contains three domains, like domain 1, domain 2, domain 3, and the drug binding site is at the domain 2. Now the carrier that this we have chosen because of its specific characteristic, that is biocompatibility, biodegradability, non-immunogenic, and non-toxic nature. And this is the methodology that we have followed. We prepared the BSN blank nanoparticle and the plumbagin loaded nanoparticle by desolvation method, then physico-chemically characterized by different analytical techniques like DLS, FSM, FTIR, XRD, TZA, DSC. Then we perform the biological activity by different assay like MTT assay, apoptosis assay, cellular uptake, and clonogenic assay. We prepared the BSN nanoparticle and the plumbagin loaded BSN nanoparticles by desolvation method and measured its average hydrodynamic size by DLS, and found that BSN nanoparticle has a size of 109 nanometer, and plumbagin loaded BSN nanoparticle has a 186 nanometer. Now further, the shape, size, and surface morphology of nanoparticle was studied by FSM, that is field emission scanning electron microscopy. And further, after getting the FSM image, we analyze it by images software, and from the image clearly shows that the nanoparticles are spherical in shape, and the size that we got for BSA nanoparticle is like approximately 88 nanometer and 104 nanometer for the plumbagin loaded BSA nanoparticle. Further, we perform the molecular characterization by FTIR, that is Fourier transform infrared spectroscopy, for pure plumbagin. Then this is pure plumbagin, then BSA blank nanoparticle, and the plumbagin loaded BSA nanoparticle. And we observe the specific peaks for specific functional group in case of plumbagin, and in BSA nanoparticle, plumbagin loaded BSA nanoparticles, we observe the peaks that are also there in plumbagin. So FTIR analysis confirms that the encapsulation of plumbagin in BSA nanoparticle. Now further, we want to characterize what is the nature of the encapsulation, whether it is in crystalline form or whether it is in amorphous form. For that, we perform the XRD data, and we perform for plumbagin, like pure plumbagin, pure BSA, then BSA nanoparticle, and plumbagin loaded loaded BSA nanoparticle. And from here we can see that in pure plumbagin we can see the specific peaks, but here in case of plumbagin loaded BSA nanoparticle we cannot see the peaks, which implies that the encapsulation of plumbagin in BSA nanoparticle in amorphous form. Now further, we assess the cytocompatibility and cytotoxicity of the prepared nanoparticles by MTTSA in a dose and time dependent manner. So these are the dose that we have taken, and time, this is for 24-hour and this is for 48-hour. Now we can observe that the blank, when we treat the MDMB 231 cells, the breast cancer cells with blank nanoparticle, the red color one, we does not see any significant cytotoxicity, which means that the blank nanoparticle or the carrier that we have chosen is non-toxic in nature and it's a highly biocompatible in nature. But when we treat the cells with pure plumbagin, that is green color one, and the plumbagin loaded BSA nanoparticle loaded, that is blue color one, at 24-hour and 48-hour, they shows a significant decrease in the viability of the MDMB 231 breast cancer cells, respectively, in both dose dependent and time dependent manner. Now it was observed that the plumbagin loaded BSA nanoparticle, the blue color one, it shows higher cytotoxicity as compared to pure plumbagin in both the cases. So it implies that the anti-cancer activity of plumbagin loaded BSA nanoparticle is phenomenally significant, effective, and successfully released and remain functional in the cancer cells. Now further, we perform the apoptotic assay to determine the changes at cellular level after treatment with plumbagin, blank nanoparticle, and plumbagin loaded BSA nanoparticle using AOATBA staining method. Now, treatment of this MDMB 231 cells with BSA nanoparticle, like the blank nanoparticle, it didn't exhibit any signs of apoptosis or necrosis, and all the cells appeared uniformly green in color in like both 24-hour and 48-hour. However, on the other hand, the cells when treated with plumbagin and plumbagin loaded BSA nanoparticles, they exhibit typical features of cell death, and the number of dead cells found to be increased at 48-hour. Now, further, we perform the cellular uptake studies to get insight of the intracellular trafficking potential of these synthesized nanoparticles, and it implies that the drug loaded, the BSA. Like the drug which is loaded with BSA nanoparticle, it shows pronounced uptake in comparison to pure drug. And quantitatively also we measure that one, the green color, and for this actually we have used the coumarin 6 because our drug is not like fluorescent, that's why. So then we use the coumarin loaded BSA nanoparticles, and here it shows like comparatively the drug which is loaded, the coumarin loaded BSA nanoparticles shows pronounced uptake, which means that the higher cytotoxicity of BSA, like plumbagin loaded BSA nanoparticles against breast cancer cells. Now further, we perform the colony formation capacity of the blank nanoparticle, pure plumbagin, and BSA loaded like plumbagin loaded BSA nanoparticle was evaluated in MDMB 231 breast cancer cells, and the cells were incubated with the nanoparticles for 7 days, and the colony forming capacity was monitored. And the control group, here we can see like in the control, and there is no significant difference between the control and the blank nanoparticle, which implies that the blank nanoparticle does not show any inhibitory effect on the breast cancer cells, and the drug delivery vehicle that we have chosen is biocompatible and non-toxic in nature. But plumbagin and plumbagin loaded BSA nanoparticle they have the potential to prevent the colony formation effectively as compared to the blank nanoparticle. So, and finally the plumbagin loaded BSA nanoparticles inhibits maximum inhibits the proliferation of the MDMB 231 cells. So from the colony formation assay, it can be concluded that the colony formation, like the plumbagin, could be effectively delivered inside the breast cancer cells, which leads to successful inhibition of proliferation of the MDMB231 cells. So in conclusion, we can say, we have successfully synthesized the like blank nanoparticle and the plumbagin loaded nanoparticles. Then the characterization was done. Then the cytotoxicity assay, the MTT and the AOATBR staining proved that the prepared nanoparticles was like selectively toxic toward the breast cancer cells only, not to the normal cells. Now the cellular uptake study suggests that plumbagin loaded BSA nanoparticle could effectively improve the delivery of plumbagin, and all the above information suggests that the plumbagin loaded BSA nanoparticles can be used as a drug delivery vehicle for intracellular release of plumbagin for potential therapeutic use in breast cancer. So finally, I would like to conclude my talk with a beautiful quote, which says, like, research is to see what everybody else has seen and to think what nobody else thought. So thank you so much. Thank you so much for your patience.
Thank you, Dr. Patel, for a very nice presentation and for finishing well within time. So we have time for questions. If there are any questions, please. I think yes, there are a couple of questions in the chat box. So Professor Gandhi has asked that is crystalline encapsulation better or amorphous, and why?
Sir, actually, the amorphous crystallization, the amorphous encapsulation is better because it increases the bioavailability of the drug. We have actually performed the drug release study as well, but here I have not put, and we can see, like, the sustained drug release in case of the nanoparticle that we have formed, like plumbagin loaded BSA nanoparticle. So basically the amorphous form, and because it increased the bioavailability of the drug.
Thank you.
Okay, and there is another question from Professor Thomas that plumbagin is often regarded as a toxin, and it is a genotoxic and mutagenic agent. So could you please comment on that?
Yes, sir. Yeah, because of the presence of the this quinone moiety, like
Exactly.
because of the presence of the quinone moiety, it is toxic
I'm
in
concerned
nature.
about that actually. I'm concerned about that because it is always regarded as a toxin.
Yeah,
So
yeah,
can
sir.
we really
So
use it?
yeah, so see, that is toxic in nature, but
Yeah.
we have tried to decrease the toxicity by encapsulating it in a biocompatible material, the albumin one. And like, we have not done the in vivo studies, but I think from the whatever studies we have performed, I think we are decreasing the toxicity by using the delivery vehicle.
Yeah. Probably we have to do very careful in vivo studies. My organic colleagues always say that it is toxic. That's
Yes,
what I
yes, sir.
made this
Yes,
comment.
that is
Thank
because
you.
of that quinone moiety.
Yeah. Very good. Thank you.
Thank you, sir.
Okay, thank you, Dr. Patel. So we had another speaker in this session, Dr. Grishma. If she is there even now, and if she is not there, then we can close this session. We had very interesting lectures from four speakers who have told us about different cancer treatment and diagnostic modalities, including chemotherapy and radio-labeled nanoparticles, and also another nice lecture on the treatment of rheumatoid arthritis. So let us thank all the speakers, and now I hand over back to the organizing team.
Thank you, Dr. Sharmika Datta, for your excellent chairing of this section.
Very good. Let us give her a big clap.
Yes.
Thank you.
And I also would like to thank all the professors for their interesting presentation in this section. And and I also would like to thank all the delegates for their interesting and innovative presentation in this section. And we had an interactive and innovative lectures from and presentation by all the professors, and it was very interesting and very helpful. And So we are moving on to the next plenary section and the last section of our conference. It is by Dr. So the chairperson of this section is Dr. Jovan. Dr. Jovan, are you there? Professor Jovan, are you there? If he is not there, I welcome Dr. Kashyar Gandhi, Department of Chemistry, University of Guelph,
Maybe
Canada.
we can request Professor Rubel, Dr. Rubel is there to chair.
Okay. So I request
Rubel, are you there? We will be very
Yeah,
pleased
I'm
if
here.
Rubel could chair.
So I welcome Dr.
Okay, thank
Rubel for chairing this section.
Yeah. Professor
So
Rubel
please
is there,
welcome.
he's a very distinguished scientist. Yeah, very good.
So
Rubel,
welcome,
please
sir,
Thank you,
and
chair.
Professor Thomas.
please chair this section.
Thank you. Good evening, everybody. I now request Professor Gandhi to give his presentation on.
Thank you. Thanks, Dr. Ruben, and thanks, Professor Thomas. I'm going to share my screen. And please let me know if you can see my screen and my laser pointer.
Yes, we can see your screen.
Okay, perfect. So I'm going to talk about using elementary particles to study nanomaterials and polymers. So that's what we do as part of our studies. I know that most of the audience are interested in applications. So therefore, at first I give some information about some of the applications of our work. I explain them, and then I will go truly only to 3 examples of how we use elementary particles for these type of applications. The 3 category of applications I explain here are polymerization in supercritical fluids, nano science, and green methods in polymerization. Let's start with nano science because it's more actually relevant to what we have seen in the previous lectures. We have studied used combination of 2 elementary particles, electrons and muons, and actually 3, and photons, to give insights into radiosensitization. So this is one example that I'm going later truly over to that. But just very briefly, I tell you in a nutshell what's the most important result here. The 2 most important results is that we develop a technique that we can in situ chemically understand the changes inside the body, or actually in the nuclear reactors if the same nanocluster is formed. And I go through that later. The second thing that might be even more interesting for the audience here is that, we have seen a lot of talks about using nanomaterials in nanomedicine for radiation therapy. This is usually called radiosynthesizers or nanoradiosynthesizers. We changed the direction of the nanoradiosynthesizer, as I will explain, because we showed the mechanism of the radiosensitization is not what is commonly believed. And that's why probably Nanoscale selected our paper as a cover article, and right after that, Department of Energy of the US featured our work. These are work that we have done based on insights from elementary particles. But the other aspect, which is far from that, is mechanism of polymerization. So we have been working not only on nanomedicine and energy, nano-based energy, but also trying to develop a greener, environmentally friendly methods for making materials, including polymers. And along the way, we had to focus on mechanism of even some of the common polymers, like polypyrrole or other conductive polymers. And we have developed techniques that we can go through understanding the mechanism of polymerization. And it's very important to understand this mechanism, because then it would let us to move into directions that we can make new material, or we can make the material more environmentally friendly by doing a better environmentally friendly using environmentally friendly process. This applied to of course new applications in solar cells, cellulose based solar cells, which we combine with composites of conductive materials based on these studies, as well as antimicrobial materials. The other direction is going into developing materials inside supercritical fluids. Now, why we do that? Because supercritical fluids can be considered greener environments for chemistry. For example, free radical polymerization is something that we have worked on in sub and supercritical fluids. I give you two examples of why this is interesting. This is the work that we published in JAX a few years ago. And what I want to show you is the two polymerization channels for making block polymers for nanopolymers that we want to make. Free radical polymerization is considered non-selective. But we showed that here is the ratio of the channels that goes through polyfluorinated versus the polyethylene type. If you have a combination of polymers that you want to make block copolymers, we showed that within close to 33 degrees centigrade, by only a few atmosphere change in pressure, you can change the ratio of the block polymers in one direction to the other one by 2 orders of magnitude or more, actually by 400 in the rate constant. So this would cause a very drastic change in the direction and control over the polymerization block polymers with only a few atmosphere pressures. That's why the mechanistic information is very important. Now, you may say, why supercritical fluids? Two reasons from green chemistry perspective. Even something like CO2 that is not considered green, if you work under supercritical fluid conditions, you can dissolve materials in it, make nanomaterial in it, and then you make an expansion and then recycle the solvent and reuse it. So that's why this is considered green. But also for fluids, when you go to supercritical conditions, the properties change dramatically. This is a picture of a flame in water under supercritical conditions. You can quench a flame with water under ordinary conditions, but in supercritical conditions, you can sustain a flame in water. That shows how drastically you can change the properties. And that means instead of using different solvents, you can move with pressure and temperature and gradually change the solvent properties as you're making different nanomaterials. So this is these are some insights from our work. But all of these applications that we have are really based on basic science. So the basic science nourished our nanomaterial innovations. Many of these led to many patents for us, and some of them in funding new even commercial products. But what I want to emphasize is that if this basic science, which was based on elementary particles, were not there, we would not be efficient in making these applications. Other examples I'm going to give you are from, results that I'm going to give you is from the work that we do on ionic liquids. So we have been synthesizing ionic liquids, novel ionic liquids for batteries for energy industry. We need to understand the mechanism of the decay of these materials in the battery. So this is where it's very important to use elementary particles. Then we develop magnetic nanofluids, which is important for fusion energy, and also other catalytic applications. So magnetic polymers that we develop from this type of work that led to interesting patents, like what I show you here. For these type of studies, you need to use certain elementary particles as a spy, microscopic spy, to tell you magnetic properties at the microscopic level. And although we started from curiosity to look at polymerization in ionic liquids, we noted that ionic liquids can go either on themselves or when you mix them with molecular compounds. As you can see here, they go through different crystalline phases. We can study them with DSC, with NMR, and with X-ray spectroscopy, and with microscopy in situ. And what we noticed is that when you go into different liquid crystalline phases, liquid phase or crystalline phase, you generate, if you make polymers, you generate enantiomeric polymers, or polymers that are extremely different with each other under these conditions. Again, this could be only understood from our basic science elementary particle applications or probing of these studies. We moved also to designing new nanostructures for health and green technology based on combination of organic and inorganic materials. We have developed ferrite-based spinels with nano cages and micro cages. Some examples I show you here. But what I want to mention is that these have applications in photochemistry. They are magnetic, so they can be magnetic catalysts, and electronic properties are extremely interesting and unique, so that we can use them for high temperature electronics. But how did we get this information, or how are we getting these informations? Are based on understanding the electron, photons, and other elementary particles in these materials. Now, these, of course, have applications for drug delivery. We can have active species in the porous materials. How we can decide to change the porosity, again, using electrons as probes in here. And when we use these, make these and make them mechanistically based on investigation at the microscopic level, and then we can see interesting results. For example, when we combine ferrite, which are ferromagnetic, with let's say Mn3O4, which would become above 50 Kelvin paramagnetic, we notice that by addition of a paramagnetic species, we're actually increasing the ferromagnetic properties because of interplay of the nanostructures in these materials. And how do we establish the understanding of this? This is where you need a microscopic probe, a probe that can be very, very tiny, as a tiny magnet. How can you get that? You need something that is smaller than the size of an atom that you can put inside the material. So these are why we use elementary particles. Now, applications are immense. Applications would be in solar power because of the what we can do with the electrons properties, electronic properties. We can develop new semiconductors, and also electrodes for batteries that would be more sustainable. They have even applications in the nuclear industry because many of these ferrites are formed under rods in the nuclear material, and therefore it's very important to understand this material at high temperature and high pressure. And environmental applications because they can be used as photocatalysts. So what are the elementary particles that I'm talking about? There are two types. There are bosonic and there are fermionic, at least based on the standard model that exists so far. And our understanding is that these are the elementary particles in the nature. What I'm going to describe are combination of two fermions, electrons and muons, and for each elementary particle, we have also an antimatter of that. So electron, matter, antimatter would be positron, muon, negative muon, antimatter of that would be positive muon. All of these have important applications in material science. And of course, among the photons, bosons, the photons are the most important ones that I'm going to talk about. Now, something that is very interesting from some of these fermions is that they are formed through weak interactions or weak decays, and these weak interactions are asymmetrics. That has implications. Asymmetry like the right-hand symmetry versus left-hand symmetry in enantiomers that we see in some of the organic materials or biomaterials.
Sorry to interrupt. Maybe your slide is not moving.
It's not moving?
No.
Oh. So none of them moved?
No.
Really? So let me see if I can. Do you see any movement or not yet?
No, we see only the first slide.
Oh, okay. I wish I would have seen this before. Okay. Okay. Let me see if I can change the type of
No.
I will. I stop sharing and I share again, but I share maybe an entire screen. See if do you
try Cash entire screen? Yeah.
Yes. So
now we can see your slide.
Now you can see. Okay. Okay. So and you can see my arrow on the screen or no?
No, we cannot see. Yeah, we can see.
You can see the arrow here or there. I want to. So I'm moving the arrow here. Can you see it or not?
Yeah, we can see.
Okay. So I'm going not to full screen. Please let me know if it changes. Do you see it there?
Yeah, we see the arrow. Yeah.
Okay. Okay. So sorry that you didn't see some of the screens. In order to do quickly, because I talked about them, I walk you through some of them slides, not all of them, because I think you should see them. You saw this first slide, right?
Yes.
Okay, so you have seen this. This one is something probably you couldn't see because the screen didn't move. This is what I'm showing about the, and it's important to see the ionic liquid crystals. And in each of these phases, we get different polymers from and different nanomaterials. So that's important to see. Another thing that is important to see is the when we go to 10% fraction of Mn3O4 in ferrites, instead of decreasing the magnetic properties. We see increase in the magnetic properties. As you can see, the blue has higher magnetic susceptibility. This is can only be understood by using the positive muons as a probe. And this one you should see. So the elementary particles that I was talking about, that I'm going to talk, is electrons, muons, both matter and antimatter, and photons. So these are the ones that I wanted you to see. Now, what I want to tell you is that for some of these studies, unfortunately, we have to go to particle accelerators. So we can't do it in our ordinary labs. Why? And I give you 3 examples with 3 whys, and I go in depth into those 3 examples. One is that sometimes you need high energy particles to mimic the harsh conditions in nuclear reactors. And it's very important for us as material scientists to use the basic science to study the materials for the nuclear reactors, because those are a source of the clean energy. We can argue about that, we can discuss that later if you want, but they are. And something that is very important, nanocluster formation in nuclear reactors is a bad thing, and we need to understand the mechanism of these nanomaterial formation. Why they are important, the reactors? Because they are considered as one of the cleanest methods for net zero energy direction and electricity direction as a base load. But these nanocluster formations can affect the performance negatively. Now, what we need is we need techniques that we can study these materials under radiation in situ, under conditions in nuclear reactors. Now, I show you what the future nuclear reactors are, which are small modular reactors and generation 4 nuclear reactors. They are either gas-based reactors that they use helium at high temperatures and high pressures. The temperatures could be up to 850 centigrade. What does it mean? That means you need to understand the material under high temperature and high pressure in helium, interaction with helium, but you need to understand also under radiation. The lead-based fast reactors, you use lead or bismuth at very high temperatures, 480 to 800 degrees centigrade, and with low pressure. But again, you need to understand interaction of material with lead in liquid form, or bismuth in liquid form. The molten salt reactors, similar to ionic liquids that I described, you have inorganic ionic liquids that would be liquid at high temperature. These liquid salts can be used from 750 centigrade to 1000 degrees centigrade. Again, you need material under harsh condition radiation in these temperatures. Supercritical water reactors, water under high temperature, 600 degrees centigrade at a high temperature and high pressure. So you need to understand material formation in nuclear reactors in order to make sure the future nuclear reactors are safe, in order to make sure that the future nuclear reactors are sustainable. So that means the material can last for a long time. Now, these nanocluster formations are bad in reactors, so you need to prevent them. You need to understand conditions to understand them. But they are good in radiation therapy because they can positively affect the radiation therapy. So these are different extremes that we need to understand at the microscopic level. So how do we know, how do we understand these? We need new techniques if we want to do them in situ. Because as you have seen in all of the previous studies, the work done ex situ, like in in the cells, cell lines, or in animal studies. But what you really need for radiation therapy is to do in situ. While you are doing radiation therapy, you understand the chemistry that is going on. What changes in the nanostructure are happening? And more important also is inside the coolant of the nuclear reactor. So one technique that we have been developing for a few years, but 3 years ago, we started, 4 years ago we started, and we are still developing that, is using relativistic particles like relativistic electrons plus photons that are whenever you have relativistic electrons going through the material, they generate photons in like a supersonic photons in certain directions. So we can use these photons to do in situ, to get in situ informations, and electrons come from nuclear reactors. Other particles come from nuclear reactors that you can use. And in radiation therapy, you always generate electrons, as I'm going to describe. So that means in situ, from inside the body or inside the nuclear reactors, we can get this radiation. And we showed 4 years ago that yes, we can see even the change in water when water becomes acidic, or when you have around 10 nanomolar gold nanoparticles inside the material. There is this different signal that you can see. As you see here, the signal for this is noisy for the gold nanoparticles because we are talking about nanomolar concentration. So how it's important to improve the signal to noise ratio. So in these 4 years, we improved. Our question was that can we replicate this one with the better signal to noise ratio? And yes, we did. So now this is going to picomolar, but you can see much less noisy signals from the same photons from relativistic electrons compared to what we get in water. And certainly we can show the difference. So we can detect dilute solution of nanostructures. We have done it for many different nanostructures. So that's something that is game-changing for the future of the radiation therapy and nuclear industry, because we can see different nanostructures, different concentrations. Now, the local minimum that we are making use of here is the plasmon resonance from the studies. So we can show subnanomolar solutions of nanoparticles. Concentration can be determined from emission instead of absorption that we showed before. We are working to see what's the upper limit and lower limit, and how do emissions vary with particle size. So we submitted something Journal of Chemical Physics letters, and we are revising that. Can we detect the size from the emissions? We showed actually we can do with a certain spectroscopic tricks. So these are different concentrations and different sizes. We showed show different signals. So this can certainly be used for remote sensing. This is the work of two great students, Alec and Quaid, in my group. We moved a little bit further now. If you do radiation therapy, it's even better, instead of using the nano material, to generate the nanomaterial in situ inside the cells when you do radiation, to make the radiation effects more localized. This we showed, for example, with different metal ions like silver. We can generate the nanoclusters inside the body, for example, and you can see the cluster formation. You can see as we increase the dose, within a second or millisecond, actually, we can see the cluster formation, and we can see the size of the cluster changing. And that's important. That means as you increase the dose, an ion like silver ion turn into cluster, into nanoparticle, and then you make the radiation effect or radiation therapy much more effective inside the cancer cells. For this one, we showed we can go even up to 0.01 picomolar. How about higher concentration? Can we study mechanism of the radiation therapy or radiation damage in a reactor or radiation therapy in the body at higher concentration of the nanomaterials? And how about getting more detailed information? This is where we need to use go beyond electrons and photons. So the elementary particles that I'm going to describe here are muons, positive muons and negative muons. They are generated from pions. Decay pion is very short-lived, nanosecond, 26 nanosecond, but it can generate something that would go within microsecond time scale, and microsecond is infinite time for chemistry. So it's it can give a lot of information in these microsecond. Now, how do we generate the muons? High energy protons in accelerators would hit nuclei. We use different nuclei targets. Those would generate pions, and then the pions decay to generate muons. Now, this is the blue is direction of the spin here, and the orange is the direction. Sorry, the blue is direction of momentum, and the spin direction is in this direction. So you can see momentum and a spin are in opposite direction to each other. I zoom here to go into a detail. These type of weak decay are interesting because angular momentum needs to be saved. So angular momentum is 0 for pion. If you get a spin in one direction, a spin in the other direction would be opposite to that. If you get momentum in one direction, because momentum is saved, momentum in the other direction would be opposite to that. Now, in the real, in more realistic picture, or not, I shouldn't say realistic, most popular picture, 99.9% of the processes in the nature, if you have something in the left going, you get something also in the right at the in the same chemistry or same physics. In this type of decays, so that means the mirror image exists in the nature. Or if you look at the mirror image of something, the chemistry or physics or biology doesn't change. Medicine doesn't change. But if you look at the decay of these processes, you see only one mirror image. So in this particular case, you see the left and you don't see the right mirror image. So that means you break the mirror symmetry, and that's very good for us. That means you get 100% spin polarization. Unlike NMR or electron spin resonance, you get something that is particle by particle sensitive, and you get 100% spin polarization. What it means is that you can detect one particle in the middle of 10 to power 23 particles. One particle in a beaker you can detect with this sensitivity. What it means also is that these particles can be energetic. So you can put them under high temperature and high pressure under conditions in the nuclear reactor, or you can do it under conditions in the radiation therapy inside conditions of inside the body. Then I'm going to show you the positive spin fate here. The positive spin of the muon or muon with positive spin would decay a positron along the direction of the decay. Because of this 100% spin polarization, you get a spin only in one direction. And that means the electron or the positron is emitted in one direction. If you put a detector, you can see the direction of the spin at the time of the decay. If you put a magnetic field, that magnetic field could be from inside the body, for example, or inside the material, then you get a spin precession. You have a spin in a magnetic field, it presses, and because you detect the positron, you can detect a spin evolution. That's the key here. The other aspect is that you need to do this in in a particle accelerator. So that means you need to put the spectrometers inside a particle accelerators that you get start from the positive protons to negative protons to positive or negative hydrogen to positive protons or positive hydrogen. Then you get the pions. In the target, you get muons. You select this into different spectrometers. And the only drawback is that there are currently only 4 places in the world that you can do that. 2 continuous force, one in Canada, one in Switzerland, and 2 pulse source, one in England and one in Japan. So I go right away to the applications radiation therapy because I know more of you are interested in that. Some of the goals of radiation therapy, advanced radiation therapy like alpha therapy, is to reduce side effects caused by radiation in normal tissues and increase the destructive radiobiological effect in tumor cells. When we got into the studies, I go and jump into the final results from the interactions of the electrons, which is one elementary particle, and positive muons, which is another elementary particle. Both of the methods showed us that if you make nanomaterials like gold or silver, but you make them in a way that the surface of the gold is free. So that means there is physisorption and not chemisorption, but a stable physisorption of the material, surfactant to the gold material. Then the interaction with electrons become much more drastic, much more effective. This was the fastest publications we had. We submitted this to Journal of Chemical Physics Letters, and within 1 day, the reviewers gave great reviews, and editors selected this as editor's choice paper. Why? Because radiosynthesizers like gold, they have been assumed that they are radiosynthesizers because they generate more electrons. In this work, we showed exactly opposite mechanism. So this was a game changer. That means if you want to make radiosynthesizer, make radiation therapy more effective, you have to go to different direction than what it used to be. Now, after the first communications, we had to get a very thorough understanding. So we started studying computationally the interaction of electrons with nanomaterials, with nanoclusters. What we noticed is that this is a nanocluster. This is not the orbital on one atom. You get the electronic wave function on the whole nanocluster. That means the whole nanocluster would become like a super wave function or super atom electronic wave function. So this was very interesting to us. And then we started looking into the electron affinity, and we found that the electron affinity is very large. And we were lucky because there were experimental work on gold with 13 atoms. And we found that our gas phase electron affinity is very similar to what we get in the experiment. So then we relied on our computational methods and we applied that to aqueous solution. And we found that, oh, the electron affinity is significantly even more when you dissolve these clusters in water. And that means the free energy is very favorable with that. But if it is like that, that means electron would suck into the gold nanoparticles if you make the gold nanoparticle available. So then the rate constant we expected to be diffusion controlled. And as you increase the size, we showed that the rate constant would increase. This was the story of the work that we did in the nanoscale. But in order to do this experimentally, we need to do 2 elementary particles. We need to use positive muon. Now, positive muon would capture an electron. So we are talking about 2 elementary particles. You get an exotic atom, which is similar to hydrogen atom, very similar to proton with electron. The radius mass of this atom is the same as the radius mass of the hydrogen atom. Therefore, the ionization potential is almost the same. The Bohr is the same. Electronically, they are the same. So that means we can use it as a probe to study in situ during radiation therapy free radical formations. And those are the most important things in radiation therapy. It's not the electron or the ion or the photon that cause the damage. It's these free radicals that are formed that cause the damage. What we showed is that when we have gold nanoparticles that have free surface, that means chemically not bound to the surfactant, you reduce this hydrogen atom formation. The interaction with this one is much faster than interaction with a positive charge. Then we did the same thing with electrons. We showed that the electrons actually get captured by these gold nanoparticles. You see, this is the fraction of the solvated electron. So the electron, before they get solvated, which is before picosecond, they get abstracted by these gold nanoparticles. So what does it mean for radiosynthesizers? That means either these gold nanoparticles are not radiosynthesizers or radiation shields in water at very low concentration, or instead of what generally people would thought, that the electrons are formed more whenever you have these radiosynthesizers, electrons are captured faster and they generate other oxidants. Or another channel is that the electron would be captured and then they form, they get catalytic reactions on the surface. Now, how does this change with concentration? Of course, as we increase the concentration, these solvated electrons, it's captured more. As we increase the size, the solvated electron also is getting more decrease. So that means this is larger effect for larger particles. Now, when we did the same thing with the palladium nanoparticles, we see a similar effect. We see that palladium, even at nanomolar, or in this case is millimolar atomic, so that, is picomolar at the concentration of the particle, they have 13 to 20% effects. So more effect with the larger palladium. Without going into the details of this, the most up-to-date study that we have done shows that most of this effect is from catalysis on the surface of the nanoparticle. Now, this was the story for the nanocluster formation for radiation therapy, and very important also inside the nuclear reactors. So that's important, because if we know under what conditions this cluster form in a nuclear reactor, we can add chemicals into the coolant of reactors to prevent them. And with the radiation, relativistic electron radiation that I showed you with the photons that we get from that, we can do that in situ. Within millisecond, we can tell to nuclear reactors operation, this is what you need to change to make sure you don't make any damage to the surface of the material in the reactors. Because we can do that in milliseconds, that means we can change the direction of radiation therapy in situ on fly while we are doing the radiation therapy. Now, this is not only for radiation. Even if you look at, for example, ionic liquids in the batteries, one important effect is the electron-induced damage to the electrolytes. How can you study that? You can do that with electrochemistry, but you need to do it with polar solvents, with electrolytes and electrodes, and it would be it would take a very long time to study this, because this damage could happen over, for example, months. But you could do the same thing with the high energy electron that generates a lot of more electrons. So you can increase the aging process. And this is, under fast aging conditions, something that you can study within months, you can do here within minutes. So that's another direction, another applications we're using. Now, as I said, we need particle accelerators for these studies, but it's not only using the positive muon. We can also use the matter muon of the elementary particles, negative muons. I'm going to tell you another applications we are developing, and that's exploring the structure under the surface, non-destructively and multi-elemental chemistry that is going under the surface of the materials. Now here we have to use a negative muon. Negative muon would be captured by a matter, then it kicks electrons out, and therefore it substitutes the electron closest to the nuclei, because it's heavy, 200 times heavier than the electron. When it captures, then similar to the X-ray electrons, you get X-ray, but you get X-ray in situ in the material. Now you get high energy X-ray because this is 200 times heavier than electron, therefore it gets very strongly bound to the nuclei. So the X-rays could go up to 6 mega electron volts. Now what does that mean for us? It means two things. The X-ray depends on the element, on the atom, and we can generate, because these are high energy muons, you can control the energy of muons with electron, similar to mass spec. You have an ion with electric field, you can control the energy. So that means you can control the penetration depth under the material. So that means, for example, if you want to do study materials for the reactors, you can do them at 1 nanometer all the way to 1 centimeter under the surface. No other technique can do that. This is also very important when you want to study radiation therapy. If we want to do, for example, radiation therapy on an animal, and as long as it's close. So for example, if it is surface skin radiation therapy or eye radiation therapy, we can explore the chemical changes. The important thing I want you to know is that you can also distinguish different isotopes. So that means if you have a radioisotopes, you can actually study them. And you can do simultaneous multi-elemental X-ray. So anything really from lithium all the way to heavy ions. The heavier the ion, the easier and the faster the technique it is. You can study. The only thing we have very much difficulty to do and takes a long time to study is hydrogen. But anything above hydrogen can be done. So even the light elements like carbon can be studied with the same X-ray, similar X-ray that you get ordinary XRF from the lead. So with that, I want to thank the organizer. I want to thank Professor Thomas and colleagues for organizing a very beautiful conference. I want to thank my group that they did all the work in our beautiful campus in University of Guelph. In general, we are doing the graduate studies with Guelph and Waterloo, so I would like to thank both universities. I want to stop here so that I can answer questions if you have questions.
Thank you, Professor Gandhi, for the very interesting presentation. In fact, sharing very unique data or experiments carried in your laboratory. The floor is now open for discussion. Any questions, please?
Maybe this is just to comment, because a colleague of mine found that when you use nanoclusters, what Professor Gandhi said, nanoclusters of gold less than 2 nanometer size with a nice surface coverage of glutathione, it can really accumulate at the cancer cell, and the activity is so profound. At the end of the business, all these nanoclusters could be removed through kidney. So that's my colleague recently published a very interesting paper. So nanoclusters have a very strong, application, as Professor Gandhi indicated for biomedical field. Yeah, which is quite interesting what you showed. And also, additionally, Professor Gandhi, we have examined some of the formulations of homeo doctor. We found nanoclusters in extreme dilutions.
Yes.
All these homeo medicines are extreme dilutions, and there's always a conflict between homeopathic doctors and chemists. They say there's nothing, but we have examined some of the homeopathic, formulations under high resolution electron microscopy, and Nandakumar and I found nanoclusters.
That's a very good point, Professor Thomas. Yes. When we started to get actually these results, because we found that this happened under extreme dilute conditions.
Yes.
I was afraid because of the controversy between the routine medicine and the homeopathy medicine. It's very similar results, and we saw similar effects that you are talking about. Not only you can have a very low concentrations, but also at extremely low concentrations, they can have huge effects.
Yes,
right?
yes.
We show that. My take on this is that we should not ignore homeopathy. We should not ignore alternative medicine.
Exactly.
It needs to be studied with actually very thorough scientific manner. As I wanted to get across, you see, lots of these studies that, for example, we do, looks like physics, but they have very much applications in medicine, right? It's a basic science. It's of course, it's a particle physics we are using here, but you need these type of studies to go into the detail of understanding, let's say, the difference between homeopathy versus the versus ordinary medicine. And another thing I want to say is that I think this should be supported by multinational government fundings, something similar to channels like United Nations, not biased by pharmaceutical industry.
Yeah, that's
not
a very
biased.
important.
Yes, so that's in my view very important, that the funding for these would not come from pharmaceutical industry, because if it comes, then you can get but we could get conflict of interest, right? Yes, we need, as scientists, I think we need to be brave, to not be afraid of testing what actually ordinary medicine tells us versus the alternative medicine. So that's important. Another thing I wanted to say, you mentioned about the nanoclusters. As you mentioned, and as we found also, they could be extremely effective. Something else that is very important, the surfactant on the surface can make a huge effect, we showed.
Yes, yes, yes.
Yeah.
They act as a shell. They act as a shell around
Yeah,
this.
and both as a shell, and also they change the catalytic effects.
Yeah, correct,
Yes.
correct. So this is something amazing what you are doing actually. I mean, Kashir, I mean, very nice. These sub-nano particle size stuff can have lots of applications.
Thank
We
you.
will really understand the physics.
Yeah, I hope I liked very much what you organized about the discussion about the horizon, Canada, India, Europe, and I think for this sort of studies, like what you said for the alternative medicine, I would call it. I think it's very important to have multinational with multidisciplines as a very big group to work together. Maybe ask for funding from multinations, so that we can do that more freely. It's very important that when we do these studies, we are not bound by one funding agency. It's multi-funding sources.
Correct. Exactly. Thank you.
Thank you.
Again, I thank Professor Gandhi and over to the organizers.
Thank you. Thank you very much to organizers. Thanks. And it's very nice to see all the students on that table, graduate students and.
Cash,
Sir,
I'm not with them now. I'm in Egypt now.
Okay.
Yes, I just landed today afternoon in Egypt. We have a 1-week meeting in Egypt.
Okay, great. Great.
I'm joining from Egypt.
Yeah. Hopefully next conference would be in Kerala.
Yeah,
I missed coming there.
The next meeting we are going to have offline. Yeah, soon. Yeah. Very nice to see Professor Gianloro. Yes. Hello.
Hi. Nice to see you. Yes. At least nice to see everyone virtually.
Yes. Please go ahead, my colleagues. Dr. Hamdan team, please go ahead.
So we are going to the concluding session of International Online Conference on Nano Materials 2022. Coming to the conclusion of ICN 2022, the conference we began at August 12th, and now it is coming to the end on the 14th of August 2022. I must say, on behalf of all the committee members, the students, professors, and the organizers present in Mahatma Gandhi University, that the last 3 days of this conference was really exciting. And I hope everyone, that including all the delegates who have participated in the conference, have enjoyed a lot during this ceremony. On this closing section of this conference, we included a fruitful brainstorming panel discussion, followed by the award distribution, and the last 3 days we had many exciting plenary sessions, invited lectures by the eminent professors, scientists and engineers from the different part of the world, including US, Europe, Poland, UAE, Mexico, Portugal, Italy, Sri Lanka, Brazil, South Korea, Czech Republic, Thailand, Malaysia, China, Japan, South Africa, Netherlands, Bulgaria, Iran, Ukraine, Australia, and from the different parts of the world, many eminent speakers give many exciting talks and had a fruitful discussion. we had discussed all the aspects of nanoscience and nanotechnology, including the advancement in the synthesis and characterization and applications of nano particles and nanotechnology. And we had discussed the nano science and nanotechnology in various fields of application, such as in biomedical applications and energy storage, energy science and technology, and sensors, etc. So in this session, we are in the next session, we are now moving on to the panel discussion. So I request before that, I would like to, we are really missing our professor, and we are still keeping a chair for him, Professor, our beloved Professor Sabu sir. We are missing him. Actually, he is leading all of us. And sir, with your permission, we are entering to the closing ceremony of this event. And I request Karen to begin the closing ceremony.
Welcome, Yusuf Aponi. Yusuf.
Good evening. I just want to thank all of you for your patience, and I'm very much excited to move to the panel discussion. Professor Satya Mova, if you'd be kind enough, would you please share the panel discussion? Would you lead the entire panel members into a fruitful discussion, ma'am?
Yes. Am I
Thank you.
audible? Thank you. Yeah, over the 3-day conference, we had several plenary sessions, invited talks, posters, and contributed lectures from eminent researchers and I'd like to invite some eminent researchers right now from all over the world to participate in this panel discussion and the brainstorming session about this 3-day conference, and also like the topics and any improvements and suggestions going forward, especially because this is like a virtual conference. So thank you everyone to the panel members for agreeing to participate with a lot of enthusiasm. Now I would like to call upon or invite for the discussion Elina Sionkowska from Poland, R.A. Ilyas from Malaysia, Ehsan Ul-Haq Qureshi from UAE, Christian Chapa Gonzalez from Mexico, Akhilesh Rai from Portugal, Masahiro Yoshimura from Taiwan, Heinz Christoph Neitsort from Italy, Tanihai Shelwan Murugdas from Sri Lanka, Sumanta Sahu from South Korea, Margarita Sanchez Domingos from Mexico, Maria S. Kuyukina from Russia, B.A. Eder Giba from South Africa, Kashir Gandhi from Canada, Anthony Shedi Azika from South Africa, Thomas Webster from US, Mayada El Sayed from Egypt, Sonalika Agarwal from South Korea, Satish Pisini from Fiji, Andres Kalyan from Czech Republic, Cheshawal Wongchusak from Thailand, Madhav Prabhakar Shawan from Czech Republic, Mansoor Binanda from Iran, Gabriela Sarja from Romania, Chovan Sitrojic from Bosnia, Asmita Datta from Israel, S.V. Prabhakar Vatikuti from South Korea, Afzal Hussain from Saudi Arabia, Khalid Al-Malki from Saudi Arabia, Syed Salman Shafkat from Pakistan, João Carlos Martin da Costa from Brazil, Jiban Basola from Nepal, Rashida Rusty from Malaysia, Ilaria Sesikoji from Italy, Seshadri Ramkumar from USA, Okar Shedu Varaprasad from Chile, Runalini V. Patarkin from US, Hector A. Ruiz, Mexico, Rotimi Sadiku from South Africa, Petra Rudolph from Netherlands, Ahmed Akbar Zadeh Pivazani from Malaysia, Maria Marudova from Bulgaria, Mohsen Sheikh Olasmi from Iran, Serhii Jean Alilko from Ukraine, Ibrahim Mustafavi from US, Hang Teacher from Australia. I now request everyone to, the floor is open for the panel discussion. I'd like to give your insights about the 3-day conference, like any topic you might have attended and are interested to talk about, and also suggestions for future conferences, the scope of a virtual conference or hybrid model going forward, and also the scope of your advice for networking, especially if you're attending virtually. In person, I think it's very easy to network because you meet in like face to face, but I think virtually it's very difficult with people like attending only like some part of the conference and virtually also. Yes, please go ahead.
So I can, Asad, I think you, the organizers did a great job. This was amazing for the scope of the presentations, and also the large variety of countries that came through. So this, I think they did an amazing job to gather all people from all over the world. As I said, of course, I miss coming back to Kerala. I miss seeing colleagues face to face. But I think now that you established such a great method for virtual conferences, I strongly recommend the future conferences to be hybrid, so that you can allow both face-to-face and hybrid for those that can come face-to-face. Of course, it would be much more difficult hybrid than pure virtual or pure face-to-face, but you develop a very good system for virtual. So in my view, making hybrid would be the way to go for the future. As something I would like to emphasize and thank the organizers. This one was even better than the previous ones that you did, and I think the reason for success was the initial, the pre-test day that everyone came on and presented, showed the presentation to make sure it worked the day before. I think maybe one recommendation for the future for the virtual presentation is that on the day of the presentation for everyone, maybe start 1 hour earlier and ask everyone also to go through a few slides to make sure it moves well, so that it would be ready. They would be ready for the real presentation. But overall, I think you did amazing job. Great job for the organizers. Well done.
Thank you, Dr. Nano.
Thanks.
Any more suggestions and feedback from other members, other panel members?
Professor Mashiro will have some comments, and she was there throughout. I really appreciate that, Professor Mashiro from Japan. I'm sure he will have some good comments. Professor Mashiro, please.
Yeah, okay. Yeah, my name, Masahiro, is a family, first name. Yoshimura is a family name. So please call me Professor Yoshimura, okay? In a European country, well, call me Masahiro, it's okay. But in a
Yoshimura.
Asia country, please call me Professor Yoshimura. Okay, well, I have not completely, but the 3 days I have joined with this meeting. And then it's a very interesting and very wide of the spectra of the conference. that I would like to comment two parts. Is that okay? Okay. One part is the many Sabu, okay, or Professor Thomas, okay. Here, nanotechnology, nanoscience, it's okay, but in that case, we must be notice about of the what is a nano, okay? If nano, it means a few nano, okay, few nanometer size. In this case, size, okay, size and surface energy contribution in a few nanometer is 30-40%. So it's a surface energy or surface effect is a more enormous than the bulk energy. Okay, but if it was a 20 nanometer or larger, surface energy contribution to the lattice energy, total lattice energy is only few percent. So that case is only the surface energy aggregation or surface energy contribution to the morphology, etc., is not exactly true. Okay, that is rather outside environment. Environment in even in a vacuum, we have never pure vacuum. It's always some molecule or atoms, radicals existing. So that case, they are make of the surface species. Surface species is more active than bulk atom and bulk complex. Okay, so the reason why we must consider size and contribution of the surface. Here, so many people talk about nanoparticle, but confusion. Okay, even that 100 nanometer. This case, surface energy effect is not so much, but mechanical or thermal or bio, okay, effect. That case, this or mechanical. That case is a bulk nano. It's a rather interface effect, not the surface energy effect. Okay. Instead, if we have the photon or electron, this case, there's a surface, the few nano, 1 nano, or less than 1 nano effect is very enormous. Band gap and also, okay. So in the presentation, many people talk about the nano size, nanoparticle, but for me, it's a little bit confusional. Okay, so that the people should consider what is the real size. If it's a molecule of the polymer itself, it's a surface and also the bulk, all right? And metal and ceramics, also bulk and surface. So what is the real size and the real activity function was came from? That is important, okay? So the reason why, and I have talked of my solution process, interface activated, direct continuous production without particle, without heating. That is possible if interface was locally used. Okay, this is my point. So many people talk about nanoparticle made and shaped, then sintered, calcined, heated, mixed together mechanically, but actually mechanically mixing of nanoparticle is impossible because a got motor or petrol as a not nano size, micron size. Okay, so that is a don't confusion of the size effect and also the real interface effect. That is the one point of the all the presentation and also the comment. And another one is I have the several presentation and I have noticed title and also the story is sometimes so big, okay? Effect of the nano technology to the some of the contribution to the property, etc., etc. That is a too vague. If it was a plenary speaker, or it's okay, but contribution or even that invited speaker is too big. It's better to the conclusion come first. I particularly for the Indian people talk about the cosmos, okay? All the cosmos starting from the very, very introduction is too long. And then the conclusion has very calm, very shortly. So that my suggestion to advise to younger people particularly, make story and straight story, short story, and strong story. Not all the data needed. Make story short, straight, and strong. Okay? Don't confusional, don't complex, don't comprehensive. Okay? That is my suggestion. So the calm conclusion to the title. Right? So that case, for example, some perovskite and then etc. But what perovskite? How it was made? Then what effect was observed? Or conclusion? What is your appealing point? Or what is the new? That is the most important to the present. Okay? Introduction and the background is not so important. For your seminar or undergraduate school, and maybe it's okay. Otherwise, here is a conference, international conference. That means all the participant is a graduate student or higher. It means already background has known. So if the time limited, give conclusion first, okay? Effect, for example, conducting effect as 30% increased addition of nano perovskite. That is a conclusion. That is my advice to the people, younger people, particularly younger people. Okay, so that is I advise 2 points. One is a nano. What is the real nano size and nano energy? Okay, thermodynamically and etc. And also the way of the presentation, straight, strong, and short story, and conclusive, come fast. That is my advice, and also the conclusion, and that's a very beautiful meeting. Thank you very much.
Thank you, Professor Yoshimura. So does anybody have, or even Professor Yoshimura can suggest any thing for networking during virtual conference? And Professor Gandhi, you are more than welcome to give your suggestions as well.
Yeah, I think the people also started to put some comments in the text as text. So I see one comment in the text in the chat box. And Professor Yoshimura, very good points on both the presentation style and also, I think, on your first comment. Basically, what you say is that there is much more need for basic science studies. We need to understand basic science of both size and interface effects much more to be able to. If that's how I translate your words into practice in order to understand the applications. Really, there is much more need to understand the basic science both at the surface and the interface.
Yeah.
Thank you, Professor Gandhi. Okay, we have a comment from Mayada El Sayed, Dr. Mayada El Sayed. Wonderful job from the organizers. My suggestion is to have a proceeding to include the abstracts. I'd also like to thank Professor Thomas for leading this effort, and welcome to Egypt. Hope you have a lovely stay. Thank you very much, Dr. Sayed. Do we have any more comments, suggestions, feedback? If not, I'd hand over this to the organizing committee. Thank you so
thank
much.
you very much, organizing committee.
Thank you.
And
Thanks.
also,
Thank you.
one
Thank
thing
you.
I'd like to say, okay, my contract in Taiwan, I have already 12 years, 30 years in Taiwan. So the Japanese condition, I don't know it really, actually, okay? And then my contract will finish in this year. So if someone would like to give cooperation in advice, please send me the email, and also I can do advice by mail, and maybe I'll return to Japan or somewhere if I have the position, I'll be there. But anyway, I can do the contribute as possible as long as long as possible. My physical condition and the health condition are all. So I would like to Sabu, okay, thank you very much for the kind invitation, and then I really enjoyed all that one. I hope. Yes.
Thank you.
So
Thank you
everybody for.
Also, we have Professor Joseph from Poland. Do you have any feedback and suggestions about the conference?
Yeah, dear Joseph, please.
Yes, maybe a few remarks. Many of the participants are looking for good cooperation, for funding from different resources, and here's my advice: to build group before trying to apply for a project. To get a European project or a project which offers good funding is very complicated, and everybody should show exactly what is the background, what is the goal, not only that the problem is interesting for the scientific community. So before the conference, some people were trying to put questions to find people to cooperate, and there were too many answers. So it was not possible for these people to build a group. And my advice is for a longer time, for a year, for months, to cooperate closer, to build a group, to find people who are strong in some specific instrumentation, some specific methods, and then to formulate the program, and after that apply for funding. Otherwise, it is a waste of time. So, and to have a good background, to publish in high in the best scientific newspapers with high impact factor and with good background and very exact formulation of all tasks and possibilities to solve the problem, you will have the chance to apply for funding. So it's my basic advice after the brainstorming session 2 days ago. So, and the conference, as usual.
You are muted.
Yusuf, you are muted.
I'm muted again. How long?
Just for 1 minute.
So I want to summarize that every conference at Professor Sabu Thomas is a huge brainstorming, and it's not so easy to find all the best ideas at once. And maybe somebody could summarize the topics in specific areas and send it to the participants to show it which direction is best to follow after the conference. So maybe some group leaders could be found to summarize the best ideas presented at the conference. And my congratulations to the organizing committee. It was a great, nice job to the participants and to us participating at the conference as people who want to see what is going on and to find new ideas also in our activity for our students and PhD students. So thank you very much. Thank you, Professor Thomas, and see you again at the
Thank you
next
so much.
conference.
Thank you so much, Dr. Joseph. Happy New Year. Now, I'd like to also invite Dr. Ilaria Cassiotti for her comments. I do read her the comments she gave in the chat. A very nice idea of sharing the scientific and research activities of own groups in order to create new collaborations and to submit common research projects. I'd like to invite you to speak more about this, and also thank you for the appreciation, Dr. Cassiotti. I believe Dr. Cassiotti, her mic is muted.
Dr. Mova,
Yes.
can you please invite? Yes, Dr. Ilaria is here, I think. Maybe.
Yeah, she is having some connection problems, I believe.
Okay, then can we move to Dr. Christoph?
Okay,
Dr.
sure.
Christoph.
Dr. Christian. Yeah, Dr. Christian, I believe.
Yes, please, Professor. Dr. Christoph.
Yes, Dr. Christoph Neitzert. Yes, please proceed. Yes, please go ahead.
Excuse me.
Hello.
Yes. Can you hear me now?
Yes, we can hear you.
Excuse me. Yes, I want to thank everyone, Professor Thomas in special, but all the nice presentations I saw. I had problems on the second and third day. In the second, I was in traveling, and now in a place where is almost no internet. No? Therefore, I have to excuse for. But I want take the occasion to thank you very much. I think it was a great conference. The date is not very easy for Italians because tomorrow is the date where everyone is on holidays, no? And therefore it was a little bit difficult. I would prefer maybe from our point of view to have a little different date. That's the only critical thing one could maybe change from our point of view. But this is, of course, every country has its special dates, and therefore it's okay. I think it was a great great organization of the conference. Thank you very much, and I'm so sorry. I would love to attend a conference in your country again, and I hope this will be possible in the next years. All the best for everyone. Thank you very much. No?
Thank you so much, Dr. Christoph Neitzert.
Thank you.
All right, I can now hand it over to the organizers.
Thank you, Dr. Satya Mova, for wonderfully handling this discussion. So I request there are many delegates. I can see many delegates who have given wonderful contribution to this event. So I am now just calling the names that I visually see in the screen. I request Dr. Mayeda El Said. Could you please come forward and say a few words? Dr. Said.
Okay, hello everyone. I think I mentioned some of my comments in on the chat, but I'd really like to thank very much everybody who has shared his talks with us in this conference, and I also would like to thank the organization committee very much. Wonderful job, you did very well. My only comment was on possibility of having a proceeding for including all the abstracts. It would be useful also to follow up with these abstracts. I'd also like to especially thank Professor Thomas for his excellent work and his bringing this together in this nice conference. Would like to thank all the organizers for their comments. Also, Dr. Yoshimura, thank you very much. And I also agree with his comment on differentiating between the nanopulk materials and the nanoporous materials as well, because sometimes people get confused in the naming of these materials. So they might not be, for example, nano on the bulk, but they are nano in their pores, for example, and so on. So thank you very much, and I hope to see you again in future conferences very soon. Thank you. I'm not sure my camera is on. I'll try, but yeah, I think it's coming up now. Yeah, so thank you so much for all your efforts. Hello, Dr. Sab. Yeah. Hope to see you soon. Okay. All right.
Thank you, Dr. Syed.
Thank you, Dr. Mova. Thanks a lot for your introduction. Thank you.
Thank you, Dr. Syed. Next, I would like to welcome Dr. Professor Veda Hari. Professor Veda Hari, could you please come forward and give your valuable suggestions and comments?
Good evening to all those who are present in India, and good morning, good afternoon, the other part of the world that also is joining today. Thank you very much, Professor Sabutama sir, for
Professor Veda, I think you are muted.
No. Is it audible now?
Yes, we can hear you now. Yes, Professor.
Okay, there is some network lag. Yeah, so I once again thank Professor Sabutama sir for making this event wonderful and interactive, because we could find the common area of interest, the scientists, so making them to interact with each other and for possible collaborations and proposal project submissions. Thank you so much. It was a nice interactive and informative session for the last 3 days. Thank you one and all. Congratulations to the organizing team. Thank you all. Thank you.
Thank you for the appreciation, Professor Veda. Yeah, please go ahead.
Dr. Sandeep Arya, could you please say a few words?
Yes, good evening to all. So first of all, I will say that this is my second conference, which is organized by this Mahatma Gandhi University, and I am attending this. And last year also, that conference was also online and similar to this. And this conference again is managed and organized in a beautiful way. So thanks to the organizers as well as congratulations to them, especially Professor Sabu Thomas sir and the whole team who has organized this conference in such a beautiful way. Thank you.
Thank you, Dr. Sandeep. Next, I think everyone present here is very important, and I request please everyone to come forward because I have limitation. Maybe I cannot reach to everyone. So you all are important. Considering all your value, I request everyone to please, if you are interested, please come forward and give your valuable suggestions.
Yeah, good evening. This is Anjana. Can I say something? Hello. Yeah, can you hear me?
Yes.
Yes, yes.
Yeah. So I would like to express my thanks to Professor Sabu Thomas and his team for organizing such a wonderful conference. And what appealed me a lot is that the collaborations, possible collaborations also one can foresee. And I wish that there would be some significant outcome due to the scientific collaborations what would be there after this conference. So once again, I thank the organizers and I foresee for some valuable collaborations. Thank you so much.
Okay. Okay, here I am Dr. Aslam Tamboli. I am audible here, sir?
Yes.
Yes. I am Dr. Aslam Tamboli, sir. Nice. Thanks, all of you, organizing committee and Professor Dr. Sabu Thomas for organizing such a fruitful and good knowledge for the conference. Next time we will arrange offline time that is the better for our some needful and some suggestions or some all things that is the important for the discussion also that is will be effective. Thanks all of you.
Thank you.
Good evening, sir. Can I add on to it?
Yes, please.
Yeah. So I'm Dr. Dhanyashri, postgraduate in the dental department. So it is like a collaboration. The first time I'm like into nanomaterials, which is not like a part of our study. So this time it was like I came to know more about the nanomaterials, and it was like a collaborative conference where I came to know so much about the nanomaterials. And thanks for organizing this conference, because we always rely on the dental conferences, and this is the first time like I came to know so much about the nanomaterial characterization. Apart from my curriculum, I learned so much from this conference. Thank you for organizing, sir.
Okay, good evening. Okay. Is it audible?
Yes, doctor. Yes, please continue.
Yeah, I'm Dibaranjan Raut. I would like to thank Professor Sabu Thomas and his team for organizing such a huge conference and covering many aspects of nanomaterial progress and its applications. It is really a wonderful interactive conference, and it will be helpful if an abstract book will be shared with all the participants. In future, it will be like if for any kind of collaborative work or something like that, it will be helpful. So I request the organizing team, if possible, please share the abstract book with all the participants. Thank you.
Good evening, everyone. This is Dr. Shabnam Dan from Allahabad. This was my first meeting in like ICN 2022, organized by Mahatma Gandhi University, and I have just been appointed. And I teach nano, and I plan to set up a nano lab in my department. So I am in the chemistry department, so it will be a very new thing for like our department to work in the field of nano. I worked in on nano. That was my thesis was the uh, first work on nano. So therefore, I got so many ideas attending the conference. Everyone they presented some really good work. So I got some really new ideas through it. So I just wanted to thank you all, the organizing committee, and Professor Thomas for organizing such a wonderful conference. Thank you so much.
Thank you, Dr. Dan. Dr. Ilhan Khan, do you have any? I request you to come forward and. Dr. Kumar Pranay. We will after the comments and suggestions, we will move to the award ceremony, award distributing ceremony, and before that, I would like to invite and ask permission from our beloved professor, Professor Sabu Thomas. Sir, can we move to award ceremony? Hello, sir. Sabu sir, are you present here?
Please go ahead. Please go ahead.
Thank you, sir. Thank you, sir.
Please go ahead. Yeah, please go ahead.
So next we will we will announce the award for. So I invite Dr. Hannah J. Maria to chair the session.
Thank you, Hiran. So I would like to welcome Silla and Rosemary to announce the poster prizes. Silla, please.
Here are the results of poster presentation ICN 22 under the field of nanomaterials. The third prize goes to P15 Anu Rose Chako, School of Chemical Sciences, Mahatma Gandhi University, Kottayam, Kerala, for the topic selective detection of mercury and amoxicillin through electrochemical switch on-off response of carbon quantum dots. The third prize is shared by two more people. Next is P19 Elhan Khan, Department of Bioengineering, Integral University, Lucknow, for the topic evaluation of anti-cancer potential of quinine seed extract-based nano-emulsion against HepG2 cell line. Third prize, P22, Harshal Thakkar, Department of Chemistry, Faculty of Science, Maharaja Sayajji Rao, University of Baroda, for the topic fabrication of large pore covalent organic frameworks on CNTs for high performance organic dye removal. Announcing the second prize is shared by two participants. P18 Charu, Academy of Scientific and Innovative Research, Ghaziabad, India, for the topic heterolayered nanostructures for removal of physiochemically diversified contaminants based on dual modality adsorption photocatalysis. Next, P34 Shabrani Paul, Department of Physics, the University of Burdwan, West Bengal, for the topic enhanced photocatalytic performance synthesized by mechanical alloying for rhodamine B dye degradation. The first prize for the poster presentation for ICN 22 Bio Nanomaterials goes to P13 Sneha Matthew, School of Chemical Sciences, Mahatma Gandhi University, for the topic carbon dot based fluorescent probe for selective and sensitive detection of antibiotics. Now the session is open for the winners to have a talk, to say a few words. Sneha Matthew, are you present?
Good evening, all. I'm Sneha. Thank you so much for this opportunity. Thank you.
Ms. Charu, Shabrani Paul.
Hello, I'm Sarvan Sabunipal. Thank you very much for giving me this opportunity. I am very glad. Thanks. Thank you all.
Anuros Chako. Ilhan Khan. Harshal Thakkar. I hope they are not present. Anyways, congratulations to all the winners. Here are the results of poster presentation ICN 2022 under the field of nanomaterials. Third prize is shared by two participants. P2 Ardra Vijay PV, R Shankar Memorial, SNDP Yogam Arts and Science College, Koilandi, on the topic one-pot synthesis of zinc selenate nanomaterial and investigation of its photocatalytic activity. Third prize is also shared by P11 Ritik Mohanty, Center for Nanoscience and Nanotechnology, Odisha, for activated fullerene zinc cobalt oxide as efficient electrode material for flexible supercapacitor application. Second prize is also shared by two participants. P7, Parbajodi Bhagavati, Institute of Advanced Study in Science and Technology, Assam, on the topic Optical Properties of Small Titanium Nitride Nanoclusters from First Principle Calculation. Next is P10, Boni K. John, School of Chemical Sciences, Mahatma Gandhi University, Kottayam, on the topic Microwave Assisted Synthesis of Nitrogen Doped Carbon Quantum Dots as a Fluorescent Sensor for Amoxicillin. And the first prize goes to P17, Bahnario Theodore, Faculty of Chemical Engineering and Environment Protection, Technical University, Romania, on the topic Hybrid Plasmonic Catalysis using Heterostructures of Metal Nanoparticles and Layered Double Hydroxides. Now I request the winners to say few words.
Hello, this is Rhetoric Mohanty, and thank you, Subhu sir, for organizing the most effective. Hello,
Yes,
conference.
yes, we can hear you. Please continue. Yeah,
Okay.
congratulations.
Thank you, and thank you. All I can say, thank you, sir, for organizing this, and greetings from my side.
Ardra Vijay, Ritik Mohanty, Boni K. John, Ritik Mohanty,
Thank you, Silla and Rosemary. So now we will announce the prizes for short invited talk. I request Milanda Tom to announce the one set of prizes on biomedical sciences.
Now I announce the winners of short invited lecture under the category of biomedical applications. The third prize goes to SIL number 19, Bonike John from School of Chemical Sciences, Mahatma Gandhi University, India. The second prize goes to SIL number 106, Donna Mary Sam from Stella Maris College, Chennai. And the first prize goes to SIL number 103, Swikriti Tripathi from School of Material Science and Technology, IIT Bhubaneswar, Varanasi. Winners, please come forward and say a few words.
Hello, everyone. Am I audible?
Yes, yes.
Thank you, Mahatma Gandhi University, for arranging such a wonderful conference based on this nanomaterials and nanoscience. Thank you all for this wonderful opportunity. We gathered so many informations and we had a wonderful experience based on these conferences and all. Wish you all the best luck.
I invite Dr. Arya Uttaman to announce the short invited lectures for the session energy.
The third prize is sharing by two peoples. Miss Wafa Al Ghamadi, Department of Physics, Faculty of Science, King Abdullah's University, Jeddah, Saudi Arabia. And Miss Mida Gajnan Naik, Department of Physics, Karnataka University, Dharwad, India. And the second prize is also sharing by two peoples. Mr. Anthony Chidi Exika, Department of Chemical, Metallurgical and Materials Engineering, Faculty of Engineering and the Built Environment, Tashwane University of Technology, South Africa. And Mr. Sheikh Rukhsana Begum, Department of Sensors and Biomedical Technology, School of Electronics Engineering, Vellore Institute of Technology, Vellore, Tamil Nadu, India. And the first prize goes to Mr. Anthony M. Sebastian, Department of Metallurgical and Materials Engineering, NIT, Tiruchirappalli, Tamil Nadu, India. Congratulations to all. Mr. Anthony M. Sebastian, Mr. Anthony Chitti Exaka, Mr. Sheikh Rukhsana Begum, Mr. Wafa Al-Ghamdi, Ms. Mida Gajnan Naik, please come forward and say a few words.
Good evening to all. Myself Rukhsana Begum. Actually, this is a wonderful opportunity to me, and this conference is very interesting, and I enjoyed a very lot, and I got a knowledge of to other people's in nano materials, nanotechnology. So, thank you so much for this opportunity, and thank you all.
Are there any other winners? Please come forward. So we are moving on to the next award section on the short invited lectures for nanostructures. Mr. Ali Akbar is going to announce the winners.
Thank you, Kiran sir. So next, I am very happy to announce the winners of Nano Short Invited Lecture given by Nanostructures, Synthesis and Characterization. So I am very happy to announce that the third position is shared by two people. SIL number 140, Mrinal Gandole, Polymer Nanotech Laboratory, RTM, Nagpur University, Nagpur, Maharashtra, and Alina and Matthew, Department of Physics and Electronics, Christ Deemed University, Bangalore. And the second position is also shared by two people. One is SIL number 122, Jayashree, Department of Applied Science, University of Petroleum Engineering and Studies, Dehradun. And another one is Grishma B. Philip, Department of Chemistry, Bishop Moore College, Mavelikara, Kerala, India. And the first prize goes to Muhammad Rehan Ansari, SIL number 143, Department of Electronic Science, University of Delhi, New Delhi, India. And also another person is also there, SIL number 139, Zina Joseph, Polymer Nanotech Laboratory, RTM, Nagpur University, Nagpur, Maharashtra. Congratulations to all the winners, and I am welcoming all the winners to say a few words about this. Please come forward. Mrinal Gandole, Alina and Matthew, Jayashree, Grishma B. Philip, Muhammad Rahan Ansari, and Zena Joseph. Please say a few words.
Thank you, organizers, giving me this opportunity to show my data here. And it is very nicely organized. Thank you, all of you.
I'm really very grateful that you gave me opportunity to present my work here, and thank you so much for having me here. The session was very interactive and it was excellent. Hope to see you again. Thank you so much again.
Are there anyone to tell say a few words? So
Thank you, ICN 2022 and all the
the members for giving me such an opportunity. Thank you all.
Thank you and congratulations for the all winners. Next, we are moving on to the award ceremony on the session photochemical reactors, and the awards is announced by Varun Balakrishnan.
The prizes for the short invited list under the topic of photochemical reactions. The third prize goes to serial number 148, Jyoti S, Department of Studies in Physics, Karnataka University. And the second prize goes to serial number 47, M. Padmini, Center of Green Energy Technology, Pondicherry University. And first prize goes to SIL number 48, Neha Redkar, Indian Institute of Technology, Bombay. So the participants, please comment forward, say a few words.
Hello, I hope I'm audible. So thank you everyone for giving me this opportunity, and this was a great platform to learn a lot of things, and looking forward to participate more conference held by Professor Thomas and the team. Thank you.
Hello, I'm Batmini sir. Thank you the organizer for giving me this opportunity, and thank you all.
I think it's finished, and we would like to congratulate all the winners of the posters, short invited lectures from on different sessions. So it is actually a very big task actually to select a winner from a group, because everyone give their excellence, and we tried very hard, and it was a very hard task to select one from the group. Actually, we had a lot of co-workers working behind to make this ceremony successful. I would like to say a few words of them. For the evaluation and other award selection, I would like to thank Dr. Ruby, M. Sam, Dr. Arya Uttaman, and Dr. First of all, I would like to thank Dr. Michael from Russia, and for the evaluating the awards, and I would like to thank Silla, Milanda, and first of all, all the driving force behind this and the running behind the stage is Dr. Hanna. I would like to thank Dr. Hanna for her wonderful contribution for making this event a great successful. And maybe due to some human error, maybe I forget some names. I'm sorry for that. It becomes and of course our dear Jessie Chechi always work hard for us, and so that's all about us. And we are moving to our ever-waiting speech from Professor Thomas. So I cordially and heartfully invite Professor Thomas for saying the concluding remarks and comments. Sir, please. Sabu sir. Yeah, we have finished the award ceremony. I invite you for your speech, valuable speech.
I think we are going to the last phase, right? Almost finished all, right?
Yes, sir, yes.
Okay. A very good evening to all of you. And dear friends from different parts of the world and India and student community, let me thank all the people who supported us for this conference, particularly Joseph Haponik, Mache. They were very supportive for this conference. Let us give a big clap to them. And all the plenary speakers, keynote speakers, invited speakers, student community, thank you all for making this function a grand success. I could see the smiling face of Yusuf Aponi. Thank you, Yusuf, for all the support. And I'm glad that so many students got award. Let us give a big clap to all of them, those who really did very well in this conference. And many thanks to American Chemical Society for supporting us. American Chemical Society is giving the awards for the winners, and all the participants will get some gift from American Chemical Society. We will send that to all of you. So many thanks to ACS, many thanks to CSIR and all the funding agencies. And I could do this basically because of support of my PhD students, postdocs, master students, project students. I thank all of them, particularly Dr. Hannah and Jesse did a wonderful job. Thank you so much. And I'm sure that this time we had a big number of participation. Next time we will definitely organize it, maybe a dual mode, a hybrid mode with more participation. More people will be able to come to the campus. So thank you so much. Have a wonderful evening to all my friends from Europe and India, and from Japan and Korea and China. Maybe it's a late evening wishes. Thank you. Thank you so much. And it's a really hard work, and all my students should take some rest. Thank you. I'm right now in Egypt. I just landed now in Egypt for 10 days stay in Egypt. Thank you. Thank you so much. Bye-bye. See you in the campus next year, or maybe next year probably we will organize a nano meeting. Thank you. Bye-bye.
Thank you, Sabu sir. And I am very happy to say that tomorrow is our 75th Independence Day celebration. And so following the concluding section, we will conclude with our national anthem.
Yes. Right.
And I request everyone to please stand as a part of the respect, and we will play the national anthem.
Yeah. Our national anthem, yes. Please start. Kiran, we can't hear anything.
My call zero.
National anthem चल रहा है.
We couldn't hear anything anyway. There was some problem probably. Let's have a photograph, together. All of you can put on the camera and let's have a photo. Put your camera on. Hiran, please take a photograph.
Sir, you are not
Okay.
visible.
Thank you then. Thank you. Bye-bye. Thank you. Thank you, Joseph. Thank you, Christoph, everyone. Thank you. Bye-bye. Thank you, Ilaria.
See, bye-bye.
Bye-bye.
Thank you very much.
Bye-bye.